Welcome, everyone. I'm Holistic Pet Health Coach Melissa Natanson, and I'm honored to be here with you today, wherever you are, for our workshop in pet loss and healing. We're all here because we understand the profound impact of losing an animal companion. And this isn't just about a pet. It's about losing a family member, a best friend, a source of unconditional love. They are our babies, after all. Today, we've gathered experts in veterinary medicine, pet loss counseling, animal communication, as well as the personal experiences of a few of our holistic pet health coaches. As we guide you through this journey today, we will offer practical coping strategies and we'll explore the spiritual aspects of your bond with your pet. We'll also introduce services for continued support after the workshop. Today, you're going to hear from integrative veterinarian Dr. Ruth Roberts, pet grief counselor Leigh Gerk, animal communicators Anya, Gore and Melissa Sherman, holistic pet health coaches Sandy Reynolds and Sunny Gandara are going to tell their stories of profound loss. They're all going to share insights, lead exercises, and offer a path toward healing and growth. Mostly, we just want you to know your feelings are valid and you're not alone. Today is about a community of support, and I encourage you to share your feelings and questions in the chat. And by the way, the chat is in the bottom middle of your Zoom, and I encourage you to find it and tell us where you're all from. We will have some time throughout this journey to answer your questions. If you need to leave for a bit and come back, that's okay too. We are here for support, and we'll have time to get to those questions and have a dedicated space for live questions at the end of the seminar. Now, while we can't erase your pain, we hope to help transform it into a celebration of the love you shared with your pet. And remember, there's no timeline for grief. Where you are in your journey, wherever you are, you're welcome here. Let's begin this healing process together. And with that, I would like to introduce Dr. Ruth Roberts. Dr. Ruth Roberts is a distinguished holistic and integrative veterinarian with more than 30 years in veterinary practice. Her extensive experience and passion for holistic pet care have made her a respected figure in the field. As our guest speaker today, Dr. Roberts brings a wealth of knowledge on handling pet loss from a holistic perspective. Her unique approach considers not only the physical aspects of end-of-life care, but also the emotional and spiritual dimensions that affect both pets and their parents. Dr. Roberts is also the creator of the Holistic Pet Health Coach Certification Program, and you're going to be hearing from a few of those coaches today, me included. This innovative initiative that bridges the gap between conventional veterinary medicine and holistic approaches to animal health has been a welcome need in all of holistic pet care. And throughout her career, Dr. Roberts has been dedicated to improving the lives of animals through a comprehensive whole body approach to health. And she's included various aspects in that: nutrition, herbal medicine, acupuncture, and other integrative therapies. And we are so honored to have her here today to share her insights and experiences with us on this pet loss workshop. Welcome, Dr. Roberts. How are you this morning?
I am peachy, Melissa, and I am so honored. And I do want to make something crystal clear. It wasn't me that organized this. It was Melissa Natanson's idea. And then she collaborated with a few of her fellow coaches that are here today and made this a reality. So this is coming from a place of the heart where we all want to help you with the thing that is the most difficult to deal with. And it is something that we all hear working with pet parents over and over again. I just don't know how I can survive the loss of my pet. I'm going to miss her terribly, all of these things. And so we were I was so amazed when Melissa brought this up because I think it's critical for people to have resources to be able to process their grief and in a like-minded community. So I was talking with Mary Jo, my wife, today. When I lost my very first baby boy, Arnold, at 17, my brother couldn't understand why I didn't just drive up to Charlotte and hang out with him for the weekend. He really didn't have the concept that at 17, my dog had been with me for longer than his son had been at 6. And so I know that many of you may have encountered that, dealing with your own family members, maybe people you know at work. Kyle has to put in her 2 cents for sure. So she's like, yeah. So So thank you all for coming today, and I'm happy we can be of service.
Well, can you
So
share a little bit more about your personal experiences with loss and how that affected you and changed how you treated your patients and and the pet parents when they were having these losses?
yeah, I mean, we don't I finished veterinary school in 1990, and certainly the resources that are available for young veterinarians now were not then. And, it's just sort of we didn't talk about it. And because I, the veterinarian, was like shutting down emotionally, we were trying to shut down the experience for pet parents emotionally. And so it took me quite a while to understand that no, that's not helpful for anyone. If we don't feel what we're feeling and talk about what we're feeling, then we are not able to help process that grief, legitimize it, and move forward and move on. So one of the as I mentioned earlier, Arnold was one of the very first soul dogs that I lost, and followed by Nepenthe, sadly. Um, but it took me a while to understand what I was feeling with them because I was in a place in of emotional shutdown. And so Arnold, as always, had pushed me to um, be present in this plane instead of out in the future worrying about what's going to happen tomorrow. So he was one of the key figures in me starting to understand what I needed to do to help pet parents understand that they did indeed have control and some level of power in this situation. Um,
What was going on
as
with Arnold? What was he dealing with?
he just was, he was my guy. So at 17, he basically died of natural causes and had worn out. But what he kept pushing me to understand is that if I didn't inhabit my heart and live there, then what I was doing was going to come off the rails. Because if I practice medicine in my brain instead of in my heart, I miss the emotional component of what's going on between that animal and that pet parent. So he really helped me back into my feelings and come back into myself with all of that, all of those lessons. And I was working with an animal communicator then um, that kept telling me that he was not going to let go until I was ready and I could deal with life as a veterinarian. And ultimately, I guess I got to that point because when he was ready to let go, he did very quickly and very gracefully. And it was an incredibly beautiful experience. And that may sound very strange, but it was a beautiful experience assisting him to crossing over to what's next after this plane. And because of that, I was able to begin to treat this daily at this point in my career experience of euthanasia as something sacred and to really honor the bond that's there between that animal and that person. And ultimately, because I'm then and my staff were included in that circle to really honor and respect all of what we are doing.
Yeah. How is it different for you? We've got Arnold we lost Arnold because he wore out. How is it different when you've had a terminally ill pet or you're helping your patients that are terminally ill?
It's hard because it feels like, and especially when they're middle-aged or young, and that's when it's incredibly difficult. When we're talking about a pet that's maybe 14 and they've got something terminal, that's hard, but it's really hard when that pet is 6. So we one of the things that I began to learn was we make bargains or agreements between our souls before we even hit this plane. And so I started to think about, okay, this sucks. One of the things that really, really was difficult for me was a 16-week old Weimaraner puppy that had fulminant lymphoma that I opened up and I was looking at her abdomen and thinking, how is this even possible? And how is this fair? So what I had to think about was what agreement did this dog and I make, because it was a really heartbreaking situation for me, let alone for the pet parent, who was an incredible breeder of Wymies, just did everything possible she could right, and she still had this horrid situation. So what agreement did we all make that this would occur? And what it was is, why is that 16-week-old puppy dying of lymphoma? This is unheard of before. And so what it started to make me do is look further into, what are we doing to our pets? What factors are at play here? What's going on? So I tried to look at every time we had a really difficult euthanasia situation, what is the lesson that's here? What is it I need to understand so that I can do better for other pets in the future?
That's right. So do you apply that when you have got, after 30 years of experience in veterinary medicine, as you stated, I'm sure you've seen your fair share of euthanasias and been there with the pet parents. So just to add a little comfort to those today, what do you say when you've got ones that come to you and say, was I too late or did I do it too late? Was
I
it the
think
right time?
right. And that's always, and even for me, it's like, God, did I do this at the right time? Was I too soon? Was I too late? And ultimately, again, that's another agreement. Our pets signal to us that, yeah, now it's time. Um, and I think that we need to honor that we get those messages, and we're doing this at the very right time.
Right.
So it's an incredibly difficult decision to make. And I think that on the human side, just as a parallel, when um, my mother was diagnosed with stage 4 lung cancer back in April of 20, that was an incredibly bizarre time, and unfortunately died 3 months later. But what I understood from that process again was that hospice was a way to keep her comfortable, but it was very much sort of a slow euthanasia process, if you will, because of the what they know is that at some point those narcotics will become toxic. But again, for her, she was good, she was good, she was good, and then boom, one day it was crystal clear. Any chi that she had left to live was gone. And so I was grateful for all of the lessons that the animals had taught me. So it was crystal clear in my mind when it came to helping my mother transition that, yep, this is exactly the perfect time. So,
How do you think
it,
we need to improve the conversation? I know that we've kind of talked about it before, that one of the reasons we're doing this is because we don't talk about grief enough in this country, whether it's human or with pet. And I
yes,
know that those of you that are joining us today, this loss is as profound as that of a human member of the family. What can we do in vet med to talk about it more? Do you think that we can change things in that perspective so that these feelings become more accepted?
it's really interesting. I think right before the pandemic, veterinary medicine was getting a lot better about honoring people's feelings and emotions and the grief process. And then during the pandemic, it got a lot worse because you were no longer, in many cases, you couldn't be in the hospital with your baby. Some veterinarians would come to the curb to help your pet transition. Sometimes it wouldn't. So it's very difficult, right?
Right.
And I think what's happened is that conversation has paid a lot of lip service in the profession. There are some practices that do amazing jobs of this. We lost our cat Pepe about a year ago, June, and we were in Charlotte. There was an amazing practice there where they did everything that I would have done for a client in terms of making sure that Pepe stayed with us, um, and uh, and so was not taken to the dreaded back until he was heavily sedated to get an IV catheter. And they really discussed how we wanted it to go for Pepe, versus just falling into a procedure. So I think in many practices, they're doing a fantastic job. If you're not getting that vibe from your veterinarian, I think it's a good thing if you have a pet that's very ill, is to have that conversation with at least a technician or a receptionist in the practice without your pet there. So you can talk about how you would like things to go, so that your desires and what you believe your pet desires are honored. And the staff is crystal clear about what needs to happen. And then, as far as supporting yourself with grief, I think many veterinary practices will give you references to someone in the area, and that's a great place to start. But you're here today, and you're here with several women that have the ability to help you process this in a very professional manner. And I think that what we need to do is understand that veterinarians don't necessarily have that skill set. They may be able to refer you to someone that does, but you may need to start looking on your own as well for someone that can support you.
Right. In the same way that human doctors, sometimes you get a good one with a good bedside manner and some that's not. And they
Yes.
eat every day. And it's hard for them to remember that although they're experiencing it all the time, it's a really profound experience for us. So as we get to the end of our seminar today, we're going to be talking about anticipatory grief. And I know you touched on it a little bit earlier in regards to it's a journey, it's a contract. But what can you do for pets and pet parents when we know that there's a terminal illness?
It's pie time, baby. So my we this is a story I've told all the coaches, but basically, it's bucket list time. If you spend time at least 5 minutes every day doing something you know that animal really loves,
Get
I think that's gonna make things incredibly, incredibly better for you, for your pet, because you're focusing on that love, that joy that life brings. Um, the pie time thing comes from my wife's father. As he was wending his way down at 94, they asked him, Dr. Franco, what would you like to eat? And he thought about it for a moment and he said, pie. I want a whole refrigerator full of pie. And so that's it. You know, what can we do that will bring that specific animal joy, will bring us joy in the bringing of that, whatever the thing is, whatever the trip is. You know, for Arnold, every morning, I got up with him and walked to the end of the dock when we still lived in South Carolina so that he could sniff the marsh air and that fresh morning dew. That was what he wanted, and that juiced him up for the rest of the day. So I think you know intuitively what it is with your own pet that really gives them joy in life.
Right. Well, and we've got a lot of people on here today that are really hurting. I've been watching the comments and we appreciate that you're here and that you're sharing your hearts and your feelings with us because this isn't easy, but we're going to help you through it. Dr. Ruth, in your amazing wisdom, Dr. Ruth knows everything, everybody.
And no,
No, I always like to say that because there's always a question, there's never a question she can't answer. But what do you feel like is one of the most important things that you want to say to our people who've experienced this loss today or may be anticipating a loss?
honor what you're feeling. I mean, this is part of what makes it difficult in the United States is that we don't honor those feelings of grief and loss and feel them. We do everything in our power not to feel them. There's a difference between staying in that place of anticipatory grief where you are immobilized and unable to enjoy the last moments, the last days, the last months with your pet. But I think it's really important to feel what you're feeling, be honest with yourself, and if you need help, seek help from someone that can help you process these feelings because we don't have a good system. I mean, in many countries, it is perfectly legitimate to go to a funeral and wail and just verbally, vocally. exude your grief out. So it may be something where if you can find someone to help you, and then also setting up your own ritual around losing your pet, about how you would heal, how you will honor their memory. I think that that is critically important too.
And before we do have a pet loss and grief counselor. She's an expert, Leigh Gerk. She's going to be coming up in just a few minutes. But before we transition over to Leigh, what are some of the holistic therapies that you like to incorporate with terminal patients? What are your suggestions, rather than spiritual, more physical, to support these pets if anybody's in anticipatory grief?
So one of the things I think that's important is at some point eating becomes really difficult. And so as pet parents, we want them to eat, 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 eat. And so maybe what we're going to do is give them very small meals of something incredibly, incredibly delicious. Um, and when we do that, then we're able to really, really make things happy, because many times we are able to give them some small joy with something super delicious. And if they're, very close to terminal, then it may be that we're going to actually make them feel worse if we really encourage them to eat a lot. The other thing is that what can you do to alleviate the pain and the discomfort and the malaise? So obviously some disease processes are painful, and that's a little clearer, but malaise, just feeling crappy, that's something that's not. So anything that we can do to alleviate that, often we can use CBD, um, and then THC products can help significantly. That may also help them feel less nauseous. Anything we can do to alleviate those symptoms, I think, is a great idea. And then Dr. Jeff Feynman has this really beautiful practice of happy meals. And literally, with his dog Archie, he speaks about taking Archie outside for a scratch and sniff walk 5,
Yeah.
6, 7 times a day. And the walk was maybe 3 minutes, because that's what Archie's energy could handle. But it always lifted him up, and then he could be relaxed and easy until it was time for the next happy meal.
That's great advice. And everyone, we want to encourage you, continue to follow Dr. Ruth Roberts on Facebook and Instagram, because the support doesn't stop here. This is a conversation that we're going to continue, and this is something that Dr. Ruth is an expert at supporting, and also training our holistic pet health coaches to support anybody who has got a pet that may be terminally ill or suffering in that way. We're here to support. Dr. Ruth, thank you so much for your brilliant mind and your contribution to the veterinary world. We are so happy to have you. And I feel blessed to know you and be one of your holistic pet health coaches. Thank you so much for being here today. It was a true honor.
And mine. The honor is mine, truly.
Thank you.
Thanks.
Well, next up, we have got a pet loss and grief counselor, Leigh Gerk. Leigh Gerk has over a decade of experience in pet loss and grief counseling, and just counseling in general. And one really fun fact about Leigh is she wrote an Indie award-winning book called Dear Brave Friend. And she has been through multiple losses of her own, and she really understands the animal-human bond better than about anybody that I've met besides Dr. Ruth. And she really gets it. So she's here to talk about some coping strategies and why this loss is different for everybody. But first, Leigh, can you tell us a little bit about why and how you got into this? What inspired you to get into this area? I think that's going to help people understand how you came up with your coping strategies.
Well, good morning, everyone. That's a great question, Melissa. So, I grew up on a farm, and so I've always had a really strong bond with animals. I had a box car that held 32 cats and had horses and baby calves and bunnies and dogs and you name it. And I loved my animals. So I started at a very young age with the human animal bond. And before I began focusing on pet loss and grief, I am a licensed professional counselor. But it wasn't until I lost my very special dog, Teddy. I loved all my animals and I lost a lot of them. but it was different with Teddy. He was more of my heart dog. So after he passed, I thought, I wasn't sure if I felt just devastated. Like I wasn't prepared for this depth of grief. And I thought, how am I going to do this? So I was looking for resources. I wanted to find somebody to talk to specifically on pet loss and grief. And it was difficult to find. So, I kind of made a promise to myself after Teddy passed. Someday I want to help people that were just like me. So, this is where it's led me, and it's an honor to help people because I think people that truly understand the human animal bond, those are the people that have the biggest golden hearts, and it's an honor to work with them.
That's right. So, how is pet loss grief different than other types of loss? People feel it differently. So, how is it different than other types of grief?
That's another good question. I believe that when people lose a pet, that it is a lot like human loss, but the difference is a lot of times people feel like they can't share it. They lack the support of. Some people are like, I've had people say, I can't even tell my family I feel this bad. They don't understand it. So sadly, it's a just enfranchised grief. People aren't they it's hard to find support. Um, People are sometimes embarrassed to say they're still grieving. And I think it's because, we don't, it's getting better, but people don't, it's more common to have pet funerals, but a lot of times people think, well, if there's not a pet funeral, it's just a dog or just a cat. And it's hard to find that support they need. So I think that the actual grief feelings are very, very similar, but it's how to get help and how to get the support for it.
Hi, Lisa. I just saw your message and we're so very sorry and we're here for you. Keep communicating with us and make sure that you're around when we can answer questions so that Leanne can help you. So, why why is it that people feel this? Can we really get to the crux of it? Why do people feel an animal pet loss more profoundly than they do the one of a human? Just a little, I'm going to piggyback off this. I've had an experience with my own dog over the past few months. She's still here. But I had the kind of meltdown I haven't had since my mom passed. I haven't had that with any other human. Why is that?
Well, first of all, I want to say, um, when you lose your pet, it's a different kind of feeling. And a lot of my clients will say, "Oh gosh, Leanne, I need to tell you this, but I'm kind of embarrassed, but this was harder than losing my grandma." And we talk about it. Why do you think that is? Well, number one, I want all of you to just take a moment and I want you to close your eyes and I just want you to think about looking into the eyes of your pet. Just take a moment. And what you see when you would look into the eyes of your pet was warmth and love and caring. How powerful is that? All the good feelings you get without one word spoken. That's so powerful. And our human family, they don't follow us everywhere. They don't follow us to the bathroom and wait for us out of the shower. They are our constant companion. And oftentimes they know what we need before we do. Um, they give us the feelings that are just so amazing. When you leave and come home, it's the best feeling when you get home. Your pet is like, oh my gosh, my hero's here. I've missed you. I love you. I appreciate you. That feels so good. Our human family appreciates it, but I don't think they express it. I always tease my husband when I would go get the mail for 20 seconds. Gracie would always be so happy to see me. And he doesn't even notice I'm gone. There's a big difference. They
I'm sorry,
really, right? Um,
husband.
so I think that's really important too. Um, Human relationships, as much as we need our humans and love them, it's difficult. there's a lot of miscommunication. There's a lot of, do I need to walk on eggshells? And with our pets, it's just simple. There is none of that thinking, should I or could I say this? It's just so simple. They love us no matter what. So
So, so to wrap that up, it's the bottom line. Human relationships can be difficult, but love with pets is simple.
it's so
The
simple.
loss is complicated.
It is complicated because, and I think that's where people get stuck. And, they're like, I know I was going to be sad. I know I was going to cry, but this depth of grief, I was not prepared for. It just takes their breath away because you don't realize how constant your pet is with you and all those good feelings they give you. So that's part of it. They're always there for you no matter what.
Yeah. What is some of the best advice that what do you find is the most common advice that you give in your pet loss and counseling groups? So Leanne runs a free pet loss and grief counseling group. And by the way, we are going to have information on that, on how you can get to your own free pet loss and counseling group. There will be links in the comments, and we'll provide links for that either in the comments or in a follow-up email, so you can find out where you can get that kind of support. But what do you find is the most common thing that you say, or the most common theme with pet parents?
Oh, one is, they weren't prepared for this depth of grief. That was a huge one. Another one is nobody understands and they feel like they have to hide it. And guilt is a huge piece of pet loss. And it's so sad because, like I said earlier, it's the people that I feel really understand the human animal bond. They have the biggest hearts. And so when I hear a client say, oh my gosh, I shouldn't have, why didn't I get him to the vet sooner? I'm a terrible pet parent. I didn't deserve him. And I had one client that did everything for her pet. She was fantastic pet parent, but she told herself that it was her fault that her dog died and that she never deserved to ever have another pet. And that's heartbreaking because it's people just like you guys. Um, Pets need people like you with your big hearts. So that's a big one. And part of the guilt, I believe, can I talk about guilt for a bit, Melissa?
Yeah, we can talk about guilt.
Um, I think people oftentimes when we're grieving, we want to know why. Why did this happen? And sometimes pet loss is not black and white, and we need to make sense of it. So that's really hard for us. And we take our role so serious. Pet families and pet parents, when they get a pet, they are fully responsible for that pet. They're going to play with them, feed them, groom them, take them to the vet. They are their whole world and they're responsible. So when a pet dies, a lot of people even feel responsible for that maybe I could have prevented it. Maybe I could have done this, but they don't have that. I tell them, life isn't fair and you don't have control of that, but they think they should because they have their whole life.
Yeah, that kind of goes back to what Dr. Ruth was saying about we have a journey and a contract on this earth, maybe whatever you believe, and it's not up to us to decide. And um, we have to release the guilt of having control over what the fate may be. Um, we've got a lot of people that are commenting on how the guilt is just eating them. And
Yes.
we had one comment, thank you for putting that, thank you for your vulnerability. She said she couldn't even leave the house. She couldn't go, her grandma passed and she couldn't go to her grandma's funeral because of the grief and the all-consuming guilt. What advice would you have for her?
I'm so sorry for your grief. It is all consuming. So my advice may be, if you don't have someone that you can reach out to for support, sometimes we kind of have to find help within ourselves. So Some things that people do when they lose a pet, or if you've lost your grandma, maybe you need to write her a letter. You know, a lot of times we have so many feelings, we don't even know what we're feeling. But if we write it down, to see the words on paper sometimes can help us understand what we're feeling. And, you know, a lot of people don't need to like to write. You don't need to write a complete sentence. It could be one word, you know, it doesn't have to be grammatically correct. Um, that helps a lot. And, you know, honoring the person or the pet that's lost, that has passed. What can I do to honor them? You know, and I always ask clients, what did you learn from this person or from this pet? You know, because they give us so many valuable lessons throughout our life. How can I utilize those lessons and continue through my life? And I think that's a really important piece to that as well. Another thing going back to guilt is I always hear the woulda, coulda, shoulda. And so the words, the what ifs, that's based out of fear and helplessness. Helplessness. So, for example, if a client would say, if only I would have got my pet to the hospital sooner, he would have lived. And so then I'll say, do you really believe that? Or do you perceive that? And then I'll have her reframe it from what if to even if. Maybe she needs to say, even if I had got my pet to the hospital, it would have died. You know, we need to reframe that because guilt eats people up. And you have to remember you were the very best pet parent. And sometimes bad accidents happen. And if you feel that you really were to blame, then your pet wants you to forgive yourself. We're only human. We need to forgive like our pets do.
That's right. Because their love, because it's unconditional, we can't feel the guilt because they wouldn't want us ever to feel that guilt.
They wouldn't. They want, you know, people say, gosh, I don't know what my pet wants. They want you to be happy. They love you so much. That's what they want for you.
We're going to, here in just a minute, we're going to bring in certified holistic pet health coach, Sunny Gandara. She is brave enough to share her story with us. And Leanne is going to be joining us, and we're going to do some live counseling with Sunny. But before we get there, I just want to touch on the guilt one more time. We did have another comment from Body Harmony. She says the guilt resurfaces often about how I took care of my boy Garland and my girls Ashley and Tiger Lily in their final days and hours. What coping strategies could you offer her? And we're going to have more coping strategies later as
Sure.
well.
Well, one of them I always talk to people about is I ask them, when you first got your pet, what was your intent? What did you want for their life? And it was all the good things. So, you know, I remind them your intent has always been for the good of your pet. And I'll say you did know your pet had cancer. What would your intent have been? Well, to get it help, you know, to do this, to do that. I remind him, your intent has always been good, but sometimes you don't get the opportunity to do that. Another thing is, people really get stuck on the ending of their pet's life. Understandably, it was the most current situation, it was the most traumatic, but in honor of your pet, when you ruminate just on the end, you have to stop and say, you know what? My pet, his story is like a book. There's a beginning, a middle, and an end. And when you get stuck in the end, you need to also think of the beginning. Where did you find your pet? How did you name your pet? All those things. The middle of his story. What adventures did you have? What are some things you did? And yes, the ending is part of the story, but don't forget the whole story. And I often tell people, you know, because they're like, I should have done this. And I'll say, take 5 minutes and write down from the very beginning everything you did for your pet. People are shocked. They're like, oh my gosh, I really did do a lot of good things. So I think we need to remind ourselves how loving we were to our pets.
That's right. That's right. And Leanne, just real quick, I want to know, and I want you to know that I heard you. We had a question about behavioral euthanasia. So let's address that when we get later to our Q&A.
Absolutely.
Leanne has got some good coping strategies when it comes to behavioral euthanasia. So we hear you. We're glad you're with us. Thank you for sharing your feelings. And Leanne's going to be able to help you with that. Leanne, hang out. So next up, I would like to introduce my colleague and my friend, Sunny Gandara. She's a certified holistic pet health coach, and her journey to support other people and pets has been a whopper. She was inspired by her dog Nacho, and the story is really pretty raw for her. So everyone, let's give her our support. She is courageously sharing her story today and her journey as to how she became a holistic pet health coach. Leanne is going to be working with her also. Sunny, we're here for you, my dear. Thank you for the courage to share your story. And thanks you again for being here. So let's start off. I know we're kind of just jumping into the deep end here, but you're now a certified holistic pet health coach, but you never thought that your journey would take you here. But there was Nacho and there was Miso. Can you
And there's
give us a
tofu.
rundown?
Yeah, sorry, my dog is barking in the background. Yeah, so I did not, of course she's barking now, sorry. Watchdog. I have mastiffs, so as soon as they hear something in the background, they'll let us know. But yeah, so it's pretty raw, like you said. I also celebrated Nacho's 1 year anniversary since his death. Halloween, which was my favorite holiday, and the kind of turned nightmarish when he passed. So it started really with, I had a dog named Miso, as you mentioned, and he died a horrific death right in front of me. He was choking on a bone, and he was 4 months, and it was just so devastating that I didn't know what to do with myself. Sorry.
You could do it, sweetie. Like we say, we're not all going to get through this dry-eyed. And I'm going to cry. Everyone's going to cry. And guess what? Your tears are welcome here. That's the reason we're doing this. These
And
are
please don't
tears.
apologize for tears.
Don't
It's
apologize for your tears, Sunny. You're so brave to share your story.
absolutely.
Thank you. So yeah, I had so much, I mean, obviously guilt. Talk about guilt, right? So all of a sudden, Nacho just came in to my life, and he's an Italian Mastiff, as was Miso, and he looked kind of similar, but he was very different. And instantly we had this connection. It was like unmatched. I've had dogs before, but it was just like he was there to save me from jumping off a bridge. And so anyway, that was my way of surviving. And then, you know, the time went on. I had a Great Dane named Scooby, and I also lost him tragically. He had eaten some inside of a toy. So I had Nacho. He was probably a couple of years old, and he died from complications of sepsis. And I had rescued him from a horrific scenario. So that was yet another tragic death. So these two deaths just made me start worrying about Nacho. What's going to happen to him? Like almost like I felt like I willed his death almost, because I was like, something bad's going to happen. Something bad's going to happen. And I felt like a terrible dog mom. And
Sunny.
so all of a
sorry.
sudden overnight, it seemed like literally overnight, because I work from home. I'm, obsessed with my dogs. All of a sudden I noticed this bump, and it wasn't a regular like lump, it was like hard, and I just instantly knew this is not good. So I took him, and my vet said, this doesn't look good. You should get a biopsy. And long story short, the a fantastic vet that I worked with in Connecticut, she called, and she's like, I'm waiting for the results. You know, if it's bad, I will give you a call, but if it's nothing, I'll just have because I'm going away, I'll have my vet tech call you. And the phone rang and it was the vet. And I was like, oh no. And she's like, and this is how like little I knew about cancer. And now I actually specialize in cancer for dogs because now I want to help other pet parents. But she was like, I'm so sorry to let you know this, but you know, your dog, the biopsy came back as hemangiosarcoma. And I was like, Heman, what? Like, I had no idea what that even was. And she's like, yeah, she's like, the only thing I can do for him now is like really to send you to an oncologist because it's a subcutaneous form and I didn't get it all. And I just couldn't hear anything anymore. It was like a bad dream, right?
And hemangiosarcoma, everyone, is an aggressive blood cancer.
Yeah, I mean, it's like you go to the oncologist and she's like, you know, he'll probably live 2 months, maybe 3 to 4 if you do chemo. And I'd already a holistic health coach for humans, and I knew that if I was diagnosed with cancer, I wouldn't go that route, and I certainly didn't want to see my dog suffer, so I declined to do chemo, and but I was not accepting that I was going to only keep him for 2 months. So that's when I really just started doing my own research, and I came across mushrooms and turkey tail specifically. I was giving him also Unite Bio and things like that. And then I met a specialist who is a specialist in Chinese veterinary medicine and acupuncturist. So long story short, 10 months later, he was fine. He was he was living, I mean, his best life. He had lots of energy and he was eating and and then the bump started coming up back and I wasn't going to remove it, but the tragic story of this is that he loved his marrow bones. And here we go with the bones again, having lost meso. But he didn't choke on the bone, but he had just eaten a lot of the actual bones. So he got constipated and needed to have it removed, literally, like they had to put a tube up his intestine and blow it out because it was like concrete. Because he couldn't go to the bathroom. I had no option. I had to help him, right? And he survived anesthesia, and I knew when he came out, he was just breathing really laboriously. But I was just so happy he was like done, and I brought him back home. And 2 hours later, he was gone, and he didn't survive because one of the tumors probably, you know, ruptured when they worked on him, and he died at home. And it was I mean, just again, the most horrific. That was my soul dog.
Sunny, thank you so much for sharing
I'm
your
so
story.
sorry,
I'm so
Sunny.
sorry. You're so brave to tell us, and we're all crying with you, my dear. I
You've
know
had a
that.
lot of, oh, go ahead.
Go ahead, Leanne. I was just going to say, I know Sunny and I have talked that, you know, one of her biggest things is the guilt. Am I right, Sunny? Yeah. Leanne, what can we do with this?
Well, first of all, Sunny, my heart hurts for you. I'm so sorry. You know, losing our pets is so hard, but it's especially hard when it's so traumatic. And I just, you know, I'm sure after your first loss, you were so, like you said, you were so worried about your other pets you had some PTSD for sure. And you probably still have some because you're just on high alert now. I wanted to say what you do now is you help parents that were just like you, right? In some traumatic situations.
Yes.
Right.
That's been, you know, that's been sort of the gift that he gave me was like I found no meaning with life, you know, when he died. I was like, what am I doing? I was in the food and wine industry. I was a wine consultant. I worked for an Italian winery. And I was like, what? Like, there's no point. Like, oh, I should tell you to drink a Chianti Classico. That sounds really, you know, meaningful. So that's when I just, you know, Dr. Ruth just came to me like a gift. Like, I don't even know how I found her, but it was like Nacho telling me, this is what you need to do, mommy. So he did give me purpose. So I'm really grateful for that. I mean, I would still keep him and still be in the wine industry if I could keep him alive, but I'm so grateful that he showed me what I'm supposed to do.
Absolutely. And I'm glad that you recognize that, because sometimes I know it was unbearable, but now you have a gift, like you said. Now you understand it. Sadly, you understand that deep grief and you can pass it on. I want to go back for a minute. You had said, I can't be trusted. What do you mean by that? Do you feel like you can't be trusted with this?
Mm, it was just like, what is the universe trying to tell me? I have love my dogs more than I love anything else on earth, and I just, couldn't keep them safe, you know?
So, oh gosh, so you have taken on these losses as your fault, right? Um, when you when we talk about that, I'm sure you've done the what ifs. Can you try to reframe that in any way with even ifs, as we talked about earlier? Um,
She may
does
not
that
have
make
heard you.
sense?
Give her an example.
Okay, so Nacho, when he had the surgery, he came home and he passed due to blood clots. So how are you feeling guilty about that?
I shouldn't have given him that bone, because he had already had a bone earlier in the week, and I usually would give him, just one bone maybe every other week. He wasn't going crazy with it, but it was just like, maybe I should have waited longer and let him see if he could pass it. But I was like, I just know my dog. I knew that he was really struggling, and he woke me up several times a night to try to go out, and I just can't see my dogs in pain, so I had to take him. And so I guess I'm thinking, if only I hadn't given him that second bone to enjoy. But then what I did do I have an animal communicator here in Woodstock, where I live, close to me in New York. And then I also, of course, have my dear friend Melissa Sherman here, who also helped me tremendously. But she told me that, no, Nacho told me, no, mommy, I loved my bones and I wanted the bones. So that was really comforting to hear. So I always recommend, if you can talk to an animal communicator, it's really just, she also helped me with miso, because that was like something different, right? So but I guess, it's still in the back of my mind, the what if scenarios that kind of drive you crazy. And I keep saying to myself, it's not going to bring him back if you keep saying it, but maybe I can learn for the next one and be extra careful then. But I'm like, I don't even know who is more careful than me with my dogs, but still
Yeah.
this happened to me. So it makes no sense, when it's your own pets, it's like very personal, and your emotions and thoughts just go all over the place. And it's really torturous.
It's that black and white again. It doesn't make sense.
Yeah.
So, I don't know the history of Nacho. I'm just wondering, so you think it was just that one bone? I'm wondering if it, again, I'm not a veterinarian, if maybe he had some issues before that bone. I'm
Yeah.
wondering if you could say, even if I had not given Nacho that bone, he wasn't well and
Right.
may not have survived. Does that make sense to you?
Yeah, I mean, it could have. Obviously, hemangiosarcoma is, things can rupture any minute
Right.
inside, right? So he didn't have it on his spleen. It was a muscular and intramuscular form, which isn't as common. But yeah, I guess, anything could have happened, right?
Right.
Um, I just, I like to beat myself up, I guess,
Sure.
and just the fact that he's not here is just such a constant reminder of, the tragedy of his death. I mean, but I also think, the animal communicator told me he wanted to go out on his own terms, because the lump was actually starting to come back, and it was kind of right under his shoulders. So he's like, if it's going to get much bigger, he might have difficulties walking. And then I would have to face the possibility of amputation, which we wouldn't do with a 150-pound dog. He was like already kind of, so I like to think of it that he went out on his own terms and he died at home, and I didn't have to make the decision to put him, to sleep.
Right.
So that has helped me a little bit. But
Have you ever written him a letter?
yes, many. And I talk to him every day.
I'm so glad that you talked to him. I think that's really important. People always say, well, is it okay if I talk to my pet? Absolutely it is. You know what? It's for that brief second, it just feels so real and it keeps you connected. So I'm
Yeah.
really glad that you do that. Um, have you ever wrote, now this isn't for everyone, but I think sometimes it's hard to have the closure we need because it's not common to have the funerals for our pets. Have you ever written an obituary for him?
Not per se, no. I mean, there's been bits and pieces, we've done, we did a big ceremony where we scattered his ashes down by some of his favorite spots down by the river. We always used to go together and he loved it. And we did it again this Thursday to mark his 1 year anniversary. And my husband took the day off to be with me because he didn't want me to be by myself, which I really appreciate. And so I try to do little things, and we put up the altar for, which is
Oh, good.
today also Dias de las Muertes, and now it's been a year or so. I feel like what has helped me also is because I held on to him so tight. I didn't want to let him go, and I felt like because he was always very worried about me. He would be so in tune with me. It's like whenever I started crying, he would run up to me, and because mastiffs are very sensitive, people think they look all like scary. I saw someone post a dog de Bordeaux and French Mastiff, and those are my loves. I love Mastiffs so much because they are so in tune with you. And so I try to think, don't be sad, because he didn't want me to be sad, right? But I also have to allow myself to go through that. So I always struggle. Do I still cry like a baby like I do now a year later? And I'll probably do it for 10 more years and 20 as long as I live. Do I stay strong for him because I want him to be free to go to the next realm and to be at peace so he can be where he needs to be? So I keep thinking about that, but it's easier to say that to someone else, but when it's your own pets, it's very, very.
Absolutely. Well, and that's really that's almost setting yourself up, right? Because how do you not cry about this? I'm wondering if it would help you if you talk to Nacho and just explain, people cry when they're sad and I miss you. But it was such an honor to be with you, and I'm going to keep your name alive by doing the work that I do, because sometimes we can't always not cry.
No, I can't help. I mean, I'm not gonna. I say I apologize kind of on sort of default, but I'm not apologetic for being emotional about him, because he was he was the love of my life. So
That's right. That's right. A lot of people ask, and I know you get this question a lot, Leanne, and for Sunny, they ask, how long does the grief last?
That's a great question. I hear that all the time because it's such an immense pain. People are like, God, they almost think it's a finish line with grief, but grief is not something you complete. Grief is more something you endure. So, in time, yes, you will have more smiles than tears, but oftentimes people, once they start feeling better, so if this was their grief, a ball, they think that in time that their grief shrinks, but actually their grief stays the same, but their world is opening up, so it feels different. So, everyone is different, but you will always grieve your pet, but not in the way that you do now. You will, like I said, you'll have more memories with smiles than tears. But when you have such a bonded relationship, um, you're going to have these feelings. So, there isn't a finish line. But don't let that scare you, because you're going through a time where you're not going to be the same person you were when you had your pet. It's kind of like an absorption of yourself, and you come out a completely different person, as you're supposed to do. So, you know, and
Give you a
oftentimes,
higher purpose, Sunny.
yeah, I wanted to say, for the longest time, when I read grief books for humans, because I felt sometimes grief books for pets was kind of didn't go as deep, or it felt like it was a different thing to grieve for your pet than for a human. For me, it wasn't, and we know all of us here that we don't look at it that way. But It was a book it's called It's Okay That You're Not Okay, because it just kind of it was about human. I don't remember the author, but it was just giving me like permission to be really, really upset and sad as if it was, I don't know, my human child, or my, when didn't grieve as much for my parents as I did for, this dog. And it just, as you were saying earlier, it's like that I didn't feel understood and very alone. And I'm almost afraid that I even haven't started to even dig deep enough about my grief, because I'm scared to open up. If I really felt it all, that I would just kind of completely fall apart and never come back again. So that's another fear I have. And finding purpose is, what's that?
I was going to say, people are often so afraid to cry because they don't think they're going to stop. I promise you, you will stop grieving. And at some point, I encourage you to dig deep, because if you don't, it's just going to stay in you, and it will come out in a different way at a different time.
Yeah.
But I understand that fear. It just sounds so harsh.
Yeah, absolutely.
Sunny, is there anything else that's in your heart and weighing on your heart that you really want to get a concrete answer from with Leanne while you're here with us?
I think that, we kind of touched on it, but like the feeling of sometimes I have is that people are like, you should move on now. It's been a year. It's, why are you still talking about this? And then that's because they were very understanding the first 2 weeks, which I think is also kind of the case in humans, right? Everyone's there for you around before the funeral and maybe right around. But then afterwards is when you feel really alone. And you're like, I'm not done. Like, I'm left with an empty hole here, and everybody's like back to their normal lives. Of course they have to. I mean, but at the same time, that's when you really need the support. But then you kind of feel they don't say it, but it's like, no, it's enough now. Like they don't say it, but I can hear it, like kind of like on my shoulder, and I feel guilty, like stupid about it.
You know what, Sunny? You are not alone in those feelings. People say exactly what you said. My family, they kind of give me the look like I should just be over it. So that's why I'm so glad that I have support groups, and I encourage people to go to a support group, because those you have a commonality, and that is, this is hard and it's going to take a long time. And that's really important. And I always tell my clients, because sometimes people are shocked. They thought, after my loss, okay, I'm going to tell my family, or my best friend, and they're shocked that they don't understand it. They just don't quite get it. And so you almost feel isolated. So I like to tell my clients, share Nacho's story with the people that deserve to hear it.
I love that. Yeah, that's great.
Yeah.
It's very true. We just had Fran said, I don't feel ever stop grieving, and I don't want to. He was my soulmate. Sounds like she shares your sentiment, Sunny. And she says, maybe I'll find peace one day, but we'll never stop grieving him. I will tell you from my experience that grief, we don't stop grieving. We just get stronger. And Sunny, he gave you a purpose, and I see you getting stronger every day with all the amazing work that you're doing. Leanne, is there anything that you want to add to that before we go to our next guest speaker?
I had it, and now I lost it here for a minute.
That's okay. You'll come back if you
We'll come back.
want to add it.
And Sunny, again, my heart goes to you. You know what? I don't know what, I believe that he's with you in a different way, and everybody has a different belief. So I always tell people, they'll say, well, do you think I'll see my pet again? And I always say, that's up to your belief system. And they're like, I don't know what I believe. And so I say, believe what brings you comfort. That's what we need. We need comfort.
Thank you, Leanne, and thank you to everyone here for giving me space. I appreciate it.
There's a lot of support. Thank you, everyone, for your support of Sunny. Sunny, thank you again. We love your heart, and thank you for sharing your story, and keep on helping other animals, because I know Nacho's light is working through you. Thank you both. I'm excited to introduce our next guest. A lot of you had asked if we had animal communicators on hand, and we do indeed. And Anya coming up next is one of them. Anya is the founder of Connected Souls. She is an experienced animal communicator, intuitive channel, coach, and healer. She has over 3 decades in holistic practices, and she brings a really unique perspective to helping people navigate the grief of losing a pet. She's also the author of Life and Soul Dog, and the link to that, if you would like to check out her book, is available in the chat. She is inspired by her own journey through pet loss. And Anya, thank you again for joining us. It's an honor to have you here. Anya is joining us from France. This is an international group, everyone. You are definitely not alone. Hi, Anya, and welcome.
Thank you, Melissa. Thank you. And
Can you tell us a
hello
little
to
bit about
everybody.
Oh, I'm sorry. Okay, there we go.
Oh, we got a delay.
Yeah, no, it's okay. So, Anya, can you tell us a little bit about how your own experience with pet loss has inspired your work and inspired your book?
Well, when my dog Zoe was dying, can you hear me okay, or is there too much of a delay?
Yeah, you're okay. Yeah,
okay.
you're fine.
When Zoe was dying, she had leishmaniasis, which is a really terrible disease, which is endemic here in the south of France and in Europe generally. In her last weeks, we had some very amazing conversations. As an animal communicator, of course, that was normal for me, but they were particularly focused on preparing me for losing her, knowing that I was not losing her, I was losing her physical presence as she was letting go of her physical shell. Of course, this is my belief system, it's my experience. Perhaps not everyone here will share that, but I think it's interesting to open our minds perhaps to the possibility of it at least. And I just want to say one thing on the back of that very moving coaching that we just saw with Sunny. Sorry, I have cat hairs on me.
That's
because
okay.
I had Lily.
If anybody understands, we do.
Sunny talked about the emptiness and this terror of the emptiness when we lose our beloved ones. And I think we can all share that and understand that profoundly. And Zoe had something very amazing to say about that at the time to me. And I don't think I even included it in the book. I don't remember now. But she said to me, what you need to do is to go into the emptiness, go right into the center of this feeling of emptiness, and there you will discover that there is no emptiness at all. And I feel that that really links in with what Leanne was saying about going into your feelings, not denying any of them, truly feeling them, because you can't not. You can try and be brave, you can try and cover it all up, but the feelings will come out in one way or another, as we know. And the feelings also connect us to the one we've lost, because there is that sense that as long as we're feeling this sadness, we're still connected and we still love them and we're being loyal. There's a lot of loyalty issues around, I think, overcoming grief in that way, or, you know, moving on to being fine, which we know.
I was just going to ask
right
if you feel people can cling to their grief because it's the connection.
Yeah. And what I suppose what I would love to share here more than anything is, and it's not always easy to convince people, and I don't even think it's my place to convince anybody, but all I can say is that I know deeply in my heart, and from these many years of experience now with people and their animals, that the connection is unbreakable. Our experience of it will change and shift over time, just as everything changes and shifts over time. You know, we we can't cling on to any moment as a permanency. Nothing is permanent in that way, except change and the flow of life and death and life again, if we believe that, which personally I do, but you know, the flow of life. And so that connection is always there, even though the details of it, perhaps the feeling of it might change over time.
Well, one of the simplest questions that I get is, are we going to see them again someday?
Well, of course, I'm going to say yes, but you know, I'm not expecting everybody to buy into that. My own experience is yes. It also depends what you mean by, are we going to see them again? To me, seeing them physically in the room might be one thing, but feeling them in my heart and feeling the love is seeing them again too. Seeing is only with one sense, you know, but we can sense with all of our senses, our heart,
Really good.
our ears, our sense of touch, you know, so that, and beyond. So my belief and from my experiences, we will. We also may see them again in the form of another animal, but that's another story. I myself have at least.
That is another story. And I think we could probably have
story.
a seminar on that. Maybe we should sometime. But if you're more interested in what Anya is talking about, I highly encourage you to read her book, Life and Soul Dog, because she's got a really important message. One of the other things that you have talked about, Anya, is you've talked about when you're feeling them in your heart, transforming this grief into love. Tell us a little bit about that.
Well, I think this is important because we grieve because we love. If we hadn't loved, we wouldn't grieve. So love and grief are intimately related in any case. They're almost like two sides of the same coin. So transforming grief into love means to me, and with people I've been working with, it means filling somehow our memories, our minds, with everything that was joyful, that was life-affirming, that was beautiful and happy, and allowing that to somehow tip the balance rather than, I don't like to use the word wallow in any kind of critical sense, but rather than feeding excessively the grief. One thing that I learned with Zoe about that was, she said to me, I said to her, my heart is breaking. I don't know what to do. My heart is breaking. She said, let it break. Just go through the break. Go through that break. And that, I think, is when she talked about, you know, the emptiness that is not emptiness at all. Go through that break and let it open your heart. So it's a break into opening our hearts, like with Sunny, that it gave her a whole new mission in life almost. So I think that's what I mean by transforming grief into love. It's not denying the grief because we can't, and that doesn't feel appropriate at all. It's truly feeling it, but not feeding it more than where it might lead us to. That would be my advice always, and to give people a kind of direction in which to continue.
More of I guess I'm taking it as more of a way to channel your grief. We'll use Sunny as an example. She took that tragedy and transformed it and now has a new career. Do you feel like opening your heart, once it breaks and we open, do you feel like that is a good technique and strategy once this heart is open to channel this grief into the next step or a new thing, or what do you often find?
Well, I think what it does is that it does it's transformative. So we will transform in whatever way our soul is destined to transform, or our soul decides we need and want to transform. So there are no fixed rules about this. It could be a new mission, as in Sunny's case. It could be simply, I say simply, but it could be our expansion of our own selves and our own growth, helping others. And I think a lot of it is to do with increased compassion for others, because when we have gone through pain, as obviously we all have, and we all will, because we will also lose other animals, you know, it is one of these inevitable things when we have animals. Then I think it's just very important to have compassion for ourselves, and also we will have greater compassion for others as a result.
That's right. That's right. Well, and you are going to share with us a special treat today, in the theme of opening our hearts, and healing our hearts at the same time. You're going to lead us in a special meditation. And before we go to our break, so just update, because we got going just a few minutes late today. We're on a little bit later schedule, so we're planning to go to break here in about 7 to 10 minutes. And before we get there, Anya, is there anything else that is just in your heart and on your mind as you're feeling through this symposium today, and you're feeling the hearts and the minds of the people that are with us, what they really need to hear before we get to enjoy your special meditation?
Well, there is something I wanted to just mention. I didn't manage to see the chat properly, but I just noticed one, and I think you mentioned it, a lady who wanted to have help with behavioral euthanasia, that there is that can happen as well. And that made me think that I did want to just mention, almost in passing, that losing an animal is not always when our animal dies. So as you know, I had an experience a year ago of having to have our dog readopted, and he is extremely well and happy, and it was absolutely the right decision. But the guilt and grief that I have had to work through with that has been as powerful as the guilt and grief we can go through when we lose our animals to death. So I just want to put that out there, that there are other ways in which we can be losing animals and grieving our animals. It might be through a separation, and that we no longer can see that animal. I think that's also part of it, and something that needs also to be honored and addressed sometimes.
Thank you, Anya. That was a beautiful way to put it, and we appreciate your beautiful soul and your compassion and support and being here today. What do you think the best way is to move forward? Would you just like to start your meditation?
Yes, I will just lead people into this meditation. So just before we start, if you're not used to meditating, or you don't like the thought of meditating, or it all sounds too woo-woo to be bearable, just use this as a few moments to relax and be present, and think of it as a little journey, a little exploration. And you can leave it at that, and it will be beneficial too. So I'm just going to channel this for you as we go. So just make yourselves comfortable, and just take a breath or two and just sigh it out. Just in a nice, relaxed way. Take another breath in and just sigh it out. And now just feel your feet on the floor, and just feel them nice and solid and flat on the floor of the room you're in. And I'd like you to start imagining that you've got roots of energy, just like tree roots growing out from the soles of your feet and going down into the floor, through the earth, all the different layers of the earth, right through the crust and all the internal layers of Mother Earth, down and down and down, until they reach the center of the earth. And once they've reached the center of the earth, I'd like you to find a way in your imagination to anchor them there, so that they're strongly placed there. Now you are connected to the earth, you're grounded and feeling very solid and safe in this space. And just imagine now that some of that energy of Mother Earth, the beautiful, nurturing, comforting, safe, and powerful energy, is starting to come up those roots gradually, bit by bit, up and up, right up through all the layers of the earth, right up through the floor and back into the soles of your feet, and continuing up through your legs, up to your knees, up your thighs, up your torso, right into your heart. So your heart is now connected to the heart of Mother Earth. You're feeling strong and safe and loved and cared for. And know that that connection is always there for you at the asking. Now, what I'd like you to do, is to think of a beloved animal who has passed away, or beloved animals, as many as you want. And just look into their eyes, imagine them looking at you. Feel the love you have for them, and receive the love that they have for you. It's pouring into you, just as your love is pouring into them. And now invite your animal or animals to come right into your heart space, imagining it as this beautiful, glowing, warm, and expansive energy that you have in your heart, and they are coming in. And just feel what that's like. Imagine what it might feel like. Imagine what it might look like. And allow your animal to commune with you, to tell you whatever they want to tell you, and you tell them whatever you want to tell them. And know that all the sadness, all the grief are expressions of the depth of your love. And embrace them, move through them, move hand in hand with your sadness. And find that your connection with your animal has never been broken and can never break. And just sit in that space of acceptance and hope and love. And ask your animal take something from you that you don't want anymore. It might be guilt. It might be all the what ifs. It might be regret. Ask them to take it away when they return to their other dimension, knowing that these dimensions are all intertwined and are all there at the same time. So they're never going far away. So ask them to take something away that no longer serves you and that you need now to be free of, to continue your journey. And perhaps you might like to give them a gift for them. And perhaps they have a gift for you. And just know that you can return to this space in your heart with your animal at any time. And you can spend longer here and enjoy each other's company in this way. And now with love, letting them go to whatever they're up to next. And coming back very gently to yourself. Know that the connection is there always. So just very, very gently start to feel your body, feel your feet on the floor. Stay grounded. Stay centered. And very gently you can wiggle your fingers and toes, maybe have a little stretch. And slowly, when you feel ready, open your eyes and come back to the room. And just look around you, keeping that grounded feeling, that connected feeling. Look around the room to reorientate yourself. Thank you.
That was beautiful. Thank you. That was so healing and serene. We so appreciate it, and we appreciate the gift of your presence today. Thank you very much. Just a few technical notes, everyone. We are about to go to our break now. Please stand by as we have a special memorial video prepared. Those of you that sent in videos or pictures, I should say just pictures, they will be on there. Also, since we got it started a little bit later, we're going to break a little later. So wherever you're at, we are going to reconvene at 55 after. So at 55 after, we are going to reconvene. It will be a 20-minute break. We'll see you in 20 minutes. Enjoy the video. And we'll see you in the next block where we have animal communicator Melissa Sherman coming up. And we'll also be talking about anticipatory grief. And then we'll also have our live Q&A with the entire panel and Leanne. So please stick around. We'll see you in 20.
dreams that you dream of, dreams really do come true. Ooh, someday you wish upon a star, wake up where the clouds are far behind. Be where trouble melts like lemon drops, high above the chimney top. That's where you find me, oh, somewhere over the rainbow. Bluebirds fly, and the dream that you dare to, oh why can't I? Well, I see trees of green and red roses too. I watch them bloom for me and you, and I think to myself, what a wonderful world. Well, I see skies of blue and I see clouds of white and the brightness of day. I like the dark and I think to myself, what a wonderful world. The colors of the rainbow, so pretty in the sky, are also on the faces of people passing by. I see friends shaking hands, singing, how do you do? They really say, I love you. I hear babies cry and I watch them grow. They'll learn much more than we'll know, and I think to myself, what a wonderful world. Someday I wish upon a star, wake up where the clouds are far behind. Be where trouble melts like a lemon drops, high above the chimney top. That's where you find me, oh, somewhere over the rainbow, way up high. And the dreams that you dare to, why, oh, why can't I? Ooh. You find me, oh, watch them bloom for me and you, and I think to myself, what a wonderful world. Well, I see skies of blue and I see clouds of white and the brightness of day. I like the dark and I think to myself, what a wonderful world. The colors of the rainbow, so pretty in the sky, are also on the faces of people passing by. I see friends shaking hands, singing, how do you do? They really say, I love you. I hear babies cry and I watch them grow. They'll learn much more than we'll know, and I think to myself, what a wonderful world. Someday I wish upon a star, wake up where the clouds are far behind me, where trouble melts like a lemon drops high above the chimney top. That's where you find me, oh, somewhere over the rainbow, way up high. The dreams that you dare to, why, oh why can't I? What a wonderful world. pretty in the sky are also on the faces of people passing by. I see friends shaking hands, singing, how do you do? They really say,
Welcome back, everybody.
love you. I hear
Welcome back. Thank you all who submitted videos or pictures of your pets. That was a very touching memorial. And if you didn't happen to see your picture, it may have been because it was submitted too late. We did have to make a cutoff in order to get the video done. But if you're still submitting them, we can maybe find another way to honor your pet. And thank you for everyone who submitted. So as we go into our second half of this healing pet loss journey, we are going to a part where we can talk about anticipatory grief, things to do with that, and other ways to honor your pet. So I'm excited that we are going to have one of my colleagues coming up. Her name is Sunny Reynolds. She is a certified holistic pet health coach, and she is going to be talking to us about anticipatory grief. She had quite an experience with her pet Kaya, and she has made a special booklet so that she can get it there. And Sandy will be joining us here soon. Hopefully she's coming back. But as we talk about that, she's going to be talking about her anticipatory grief, and she's going to be joined by Melissa Sherman, who is going to give us insights with her animal communication. And there's Sandy. Hi, Sandy. Welcome. We're happy to have you here. So like I said, Sandy is a certified holistic pet health coach, and she is the owner of Enlightened Mutt. Thank you, Sandy, for joining us today.
Thank you, everyone. I love the tribute. Beautiful pictures.
Yes, beautiful. It was so nice to see all those little sweet souls. So you're going to be talking about anticipatory grief today. Tell us a little bit about why this topic is so important to you and what your personal experience is and why you had to get good at it, for lack of a better word.
You know, growing up with animals my whole life, I've lost quite a few, as many other people on here have. It never gets easy. But I think in just the past segment where we were talking about our grief, regrets, guilt, all of that kind of stuff, I've had all of that with all my animals, especially my horses. And with Kaya, she was more sick since we rescued her when she was 11 months. So all the years of going to the vet, specialists, trying to figure out how to feed her to help her, and I really didn't get anywhere. And it wasn't until she got really sick a few years ago, and I honestly didn't know if I had much time left with her. And I dug in, figured out how to feed her, how to help her feel better. Then on top of that, I found Dr. Ruth's program, and I learned so much more on top of that. And when it came time for Kaya's end, I had no regrets. This time I actually literally felt like I did everything I humanly could possible for her to make her feel better, even though she was sick. She loved her food. Melissa Sherman and she did animal communication with me, and it just validated everything that I was doing was helping her, making her feel the best that she could. I mean, ultimately, we can't keep them forever, right? And that's what we would love to, but you want to make it memorable, peaceful. And even though I still sobbed this whole time watching everybody else, and I probably will cry here too.
It's okay.
You still miss them.
That's right.
You can't get over that, right? Like it was said earlier, they follow us to the bathroom. I have boxers. They think they're 3-pound, lap dogs. And that emptiness when they're gone is really hard. And the things that you did with them. We were fortunate enough for the last couple of years to be able to travel in our RV and go camping and hiking. And Kaya absolutely loved that. And she was so happy. So not everybody gets a chance to do that. And I think that was part of helped me realize you got to live in the moment. Your pets take on your feelings. And when you start to worry or think about, oh no, today's not a good day, or you have all of this anticipation of, oh my God, when that day comes, what am I going to do? How am I going to handle this? So
Sandy, can I stop you for a second? Will you tell everyone what was going on with Kaya so they understand a little bit more of your perspective?
yeah. So Kaya had IBD, a lot of tummy issues, allergies, that kind of stuff. But at the end, she did have lymphoma, and we chose not to do any chemo or anything either. So she made it to 13 and a half, and my vet told me that she would be lucky to make it to maybe 10. So, don't hold stock in any of those numbers or dates that you're given. Literally live every day and just do the best that you can. That's all that your pets want. And I think that we all do an amazing job, no matter if you are beating yourself up and don't feel like you did. You love them with 1,000% of your being, and everything you do is to help them, right? So whether it's feeding them their favorite food or snack, or going on their favorite walking spot, or swimming wherever, I mean, those are the things that, and the memories that you want to cherish with them. So going through with Kaya towards the end, I mean, I had to carry her. She couldn't walk anymore, hardly. And just assisting and those kind of things, but finding it so hard not to look at her, or having to pick her up and not want to sob just because you feel terrible. I made it so she wasn't in pain. We still did the things that she loved. Even the day that she passed, we went out for a walk on the street. We made it a few feet and we came back in. But she got to sniff and do her thing, and her tail was wagging, and she loved it. So just bringing yourself back to, what does your pet love? What do they enjoy? Do those things. If they need assistance, or you need to get like a belly band or something to lift them, there are lots of things that you can do. And as a pet health coach, I think that with Dr. Ruth's training, that's one of the things that I have found so valuable, is that there's so many other things that you can do to help with pain relief, mobility, cognitive issues, things like that for aging pets, not even just sick or terminally ill pets. There are mushrooms, there are CBDs, the options are so vast now. If you find someone who knows how to help you with that, it can be a game changer. And with Kaya, it was a complete 360 compared to losing all my other pets, because I felt helpless. I didn't know simple things to do. I lost a kitty a few years ago to kidney disease, and I was sent home with IV fluids, and I gave him fluids in his neck every single day for 6 months, forced him to take a pill to feel better. And then one day he just said, I don't want to do it anymore. And I stopped. But now I know there's so many more things I could have done to make him feel more comfortable. I could have made the end less painful. I could have fed him differently. So in my heart, those are the ones that I have issues with, of feeling like I could have, should have done more, right? But after Kaya, going forward, I am anxious to help other people, because you can have an ending that you do feel satisfied that you literally did everything you could. I mean, there's a way so that you don't have to feel that guilt, at least. Yes, we still miss them. Yes, I still grieve. I cry a lot, but I cry happy tears. It's usually a happy memory or a feeling that she made me feel. But it's just so much different if you can turn that anticipatory grief around into a positive thing and make good memories at the end, instead of dwelling on how sick they are or what the situation is, because it's really hard. I'm not saying I mastered it, but I took the steps, and I literally every day had to fight that urge to worry and stress about it. Whenever I started to do that, I just brought myself back, gave her a hug and a kiss, petted her, She loved like the top of her head scratched like this. So I would just sit there and do that with her for a while, and her little tail would go. She was happy, and it would just really ground me and remind me that, you know what? It's just me and her. It's just us. I don't care what tomorrow brings. Today we're happy right now.
That's right. And you wrote a beautiful guide on anticipatory grief. That is available in the comments. Delora DeVore, our chat support, had put that in there. So if you're interested in talking with Sandy or seeing her guide, that is in there. Can you highlight again for us the 5 steps that you think are the most important when someone is going through anticipatory grief?
Yes. So taking care of your pet is usually at top of mind, right? Because sometimes if they are terminally ill or have some kind of issues, it's maybe medication, different food, assistance going out to the bathroom, those kind of things. So I just have some little tips on each of these just to help remind you of maybe getting your head back into the right space. Number 2 is practical preparations. Maybe you need to make some adjustments in your home for your pet. Maybe as they get older, they're slipping on the floor, that kind of thing. So I just have a few ideas in there. And number 3 is just take one day at a time. I know it is so hard to do, and I'm saying it, but I speak with conviction and really focusing on that with Kaya. It really, really helps if you, I think, in conjunction, feel good that you are doing everything you can, because we all, I feel like most of the time, feel we're missing something or we're not doing everything. But if you can prepare ahead of time and try to process some of the things you're going to have to think about, if you have to go the route of euthanasia, do you have a hospice vet number available to you if you wake up and it's a bad day and it's not going to go good? You want to have your care team numbers ready in case you do need help. Do you want to do a bucket list with an animal communicator? I felt that just very loving and sweet. I already felt I knew what Kaya liked, but she,
We're here, Sandy. We got you.
she indicated that she loves her kids to come home. They're my kids, but she thinks they're her kids.
Oh,
And,
in true boxer mama fashion, right?
yeah. So on her last day, the house was filled just like she described to Melissa. All the kids were here, and it was beautiful. She was happy, she was content, she had her whipped cream, and that day she was having a hard time breathing and had taken on a lot of water over the night. And so when they gave her some sedative, she started snoring, and it was her normal snore like she used to do every night. And she was so peaceful that I think that for me was the point when I knew it was the right time. I did it right, because we have talked about, do you do it too early? Do you do it too late? And I do truly feel in my heart that if we would have waited any longer, it would have probably, it wouldn't have ended so peacefully, So, but just even having that communication and finding out that her favorite time is when everybody was home and everybody was in the room. And even though she was kind of quiet and loved to just lay on her bed, she absorbed all of that. She knew everything that was going on. She was our protector. So in preparing for the ending of a pet's life, if you can have those things already at least thought out in your head, because when you get to a moment or it's an urgent time or day and you're not prepared, it makes it so hard when you have to consider, oh my gosh, am I using a hospice vet? Am I going to an ER? Do I want to cremate? Do I want to bury them at home? and I know it's hard enough for people to discuss this for themselves, but I find it way harder for me to consider these things for my pets. But having all of that mapped out for Kaya, I didn't have to stress about that day.
It's a
I
huge
would,
weight off your shoulders to not have to be overwhelmed about that.
right. I have to say, I did not call the hospice vet ahead of time. That I should have done. And I would recommend people to do that and at least get your name and information in there, because as you're crying, it's really hard for them to understand words and phone numbers and addresses and things that are not important at the moment, but they need to have, right? So if you can, at least make some of those decisions enough ahead of time so that you don't have to worry about that, really takes a load of stress off of you. And I mean, I've had grandparents who literally planned their whole funeral and paid for it. And I thought that that was so weird, because why? That's morbid. Why would you do that for yourself? But they did that in loving care of us so that we wouldn't have to do that. And I now see the value in doing that for my pets ahead of time, because that last day I wanted every minute with her. I didn't want to waste it on the phone. I didn't want to be thinking about anything else. She was getting her head scratches and being loved on, and that's how it should be. Number 4 is emotional balance. It kind of just a few tips for you to keep yourself in the moment and how to rein yourself back in. And then number 5 is family support, because a lot of us have other people in the household, not just you and your spouse maybe, but you may have younger children, or you may have other family members, and just being prepared. Some people aren't as attached to these animals as we are. And I know that's just hard to imagine, right? But at least letting them know your feelings, and there's just a few, tips in there to kind of navigate through that.
That's right. And I was really, I'm really intrigued by this concept of a bucket list. I guess it's always been something that has been associated with humans. And here in just a minute, we're going to bring on Melissa Sherman. And she was the one that really kind of helped you with this bucket list. What were some of the things on Kaya's bucket list, and why would you encourage people to do the same?
Kaya had on her bucket list that she loved when I took her on walks alone. When we adopted her, she was the only dog for quite some time. And then my son brought home another dog, and then she passed away. And then my daughter was living in a situation where she couldn't have her dog with roommates for about a year. So then we brought her. And then when she left to go with my daughter, then we adopted Roxy, who's another boxer. And she just looked at her like, oh God. She had so much energy. Kaya was getting older, and you could just see the look on her face. It was actually kind of comical about, she's just would look at her like, why are you so crazy like that? So when Melissa told me that she liked to do walks alone with me, and when she liked my alone time, that was very important to me, because a lot of times we walked the dogs together, or we were always home together. So it made it nice, because I concentrated and took her for more of her short walks by herself. And as she got to where she couldn't move as well and that kind of thing, it was just her and I. So I would have never known that if Melissa had not told me that. So just knowing that I helped bring that special time to her that she valued with one-on-one time with me, just made me feel better that I was doing what she wanted. And then the other thing was that she pictured her family and just everybody in the house in the same room and laughing and being their normal silly selves. And then we could make that happen for her on her last day.
Well, I'm honored to have you here and that you shared your story, Sandy. And speaking of, let's bring in Melissa Sherman to join. We've been talking about her, and she was the one that communicated with Kaya and helped you form the bucket list. So we're excited to have her join. Melissa is a certified holistic pet health coach, animal communicator, and animal energy practitioner with certifications in both pet health and energy healing and animal nutrition. Melissa brings a unique, multifaceted approach to pet care, and her expertise spans behavioral issues and end-of-life issues, and she likes to make a special focus on giving animals a voice. Melissa, thank you for joining us.
Thank you for having me. And
We've
thank
all-
you, Sandy, for sharing that. It was such an honor to be part of Kaya's journey and your journey. And it really meant the world to me too.
Why
Now-
both of you are on here, kind of share that experience. Sorry, Sandy, I didn't mean to jump in
Yeah.
there, but
No, I was just going to say, I really want to preface to people that doing the bucket list is not a sad thing. It is actually very humbling and just a special experience. Because I think if a lot of people haven't worked with someone like Melissa or an animal communicator, they don't know what to expect, right? But it's a very positive thing. And if you are at all interested in what your pet has to say, or I mean, a silly thing that they might like that you don't even know, you don't learn anything bad. Melissa can explain that, but it's all in such just a loving and informative way to help you process potentially things that you haven't maybe done with your pet yet.
Yeah.
Melissa-
And go ahead. Sorry. I was just going to say that, the best thing about the greatest thing about the bucket list is it really helps bring you out of that anticipatory grief where you're kind of swirling in this world of chaos and fear. And it helps just kind of bring you back so you can be present with your animal while they're still here. Because a lot of times when we get into that fear, we're missing out on their presence. We're missing out on the time that we still have with them physically. And, we don't want that, right? Of course we don't want that, but how do you snap out of that anticipatory fear? Because it's real, it's big. A lot of times people describe it as bigger than the loss itself. And, I have personal experience with that as well, where I was ripped from just the fear in my mind took me away from being present with my animal. And the bucket list can really just tether you and remind you to do these things that your animal loves to do with you. And it's just such a different experience than not knowing or not being present.
And Melissa, how do they usually communicate their end of life wishes or needs? How does that?
So with the bucket list or just
In general, either way, whether it's a bucket list or if there's something else.
So with the bucket list, it's, we go through their favorite things and what do you like to do? What do you want to do with your time that's remaining? And they'll show me what they love. Sometimes they'll tell me things like walking alone. That doesn't mean anything to me, but that was something significant to Sandy where she's like, oh, okay, so Roxy can't come, right? Like it was very significant to her, but to me, I'm just a conduit for that message. As far as the end of life wishes, when I do my initial consultation and I connect with that animal just to gauge where they are, where are you? Do you want assistance with your passing? Are you ready to go? It's simple questions, but I can get a feeling from them if they're not ready yet. They still have something to do. And, sometimes we can dig deeper and see what is that they're holding on to. And then, there are times when they do convey it. I need help. I need help in my passing. And that's kind of, that's when assisted euthanasia would come into play. But that's not always the case. Sometimes they want to go naturally. And a lot of times that's the message that will be received up until the time that changes. So it's not a one and done. It could change over time, just like with humans. If you've ever had somebody that's lost, they have good days and bad days too. So you do want to take that into consideration when making that call.
So I've always been interested. I've always wanted to ask you this. they say that humans are the only mammal that knows that they're going to die. How does that work with animals? You know, if they live they live for today, they live in the present. Do they uh, help me out here? Do they think about
I
it
think
every day?
it's different. I think they think about it differently. They're still more in the moment. They're not as afraid of it as we are. They surrender to things because they don't hold on to that fear of the unknown. Because to them they are minute to minute, right? They don't have regrets. They don't hold grudges. I mean, animals are just so beautiful and so full of love that they just kind of float into the next, what is next. But they can sense a decline and they can sense that this chapter is about to close.
Do you feel like they hold on for us? And if so, what can we do to help them release and float on into over the rainbow bridge?
Yeah, many times I've received that message that they are holding on because their guardian is not ready. And they're worried about their guardian. They're worried about what's going to happen when they leave. Are they going to be okay? So they still have that love bond that they want to protect us. So sorry, I just lost my train of thought. But that they do hold on. And then the advice I would give is just when make peace with it and have that conversation with your animal, whether you say it to them with words, whether you meditate and open your heart like Anya showed us, and just connect with them and say, like, it's okay to be sad. It's okay to be heartbroken. It's okay to say that and say, I'm going to miss you a lot when you're gone, but it's okay. You can let go and I'm going to be okay. And if there's anything else that is unresolved that needs to be taken care of, take care of that for them and just help them to let go because they do hold on for us.
Yeah. Sandy, what is one of the biggest ways that Melissa helped you? Now, she has the possibility to use Reiki or AFT or EFT. I meant AFT. EFT. There's also an energy technique called Scholar Wave that can support animals in their end of life process. And Melissa, I want to hear more from you. But Sandy, what do you is there one thing that Melissa told you that you felt made the biggest difference and kind of changed the trajectory of this relentless, anticipatory, I just can't let go of how bad this is going to hurt for me?
I honestly think that I had a turning point when we did the bucket list. I think it gave me something else to focus on and trying to give her short little walks alone and that kind of stuff. When Kaya was having trouble because of fluid and that kind of thing, difficulty breathing, just fast, rapid breaths and stuff at times, Melissa did scalar wave and Reiki with her, and that would help her be able to breathe better for a time. So that was just part of the whole list of everything I was doing. But everything complemented each other to make her comfortable. So we did whatever was needed of the time. So if it was CBD or if Melissa needed to do some energy work with her, it was just purely based on what the day was, because it was different every day.
Yeah. Melissa, what other ways do you support? I mean, we have the Reiki and the EFT and the Scholar. Tell me different ways that you use that with some of your clients to support them.
So I use them towards the end of life. I do them. The energy sessions are also a way that I can do a check-in, and it's a quick check-in where I can do a scan. And I think this may have helped Sandy as well, just to say, like, this is what Kaya is showing me as far as her symptoms. And then Sandy could adjust what she was doing with the supplements to help support her. Or if she needed maybe to take it easy one day, then maybe she knows, okay, she needs to rest for today. So there's more than just offering the comfort through the energy. There's also that check-in that is, hey, how's it going? Where are you? Where are you in this journey? Do you still want to do this naturally? Are we still on this path? And, that carries on, and it's a way to offer her comfort. And I think it also offered Sandy comfort, because she's watching her dog who is declining, and that gives you anxiety. You don't want to see them hurting. So knowing that they're getting a little bit of peace, I think it can help put the person at peace too.
Absolutely. I think that's where the part of me having no regrets with Kaya is, because I knew that we exhausted every effort to make her comfortable, and I did all of the things that I knew she loved. And sadly, I feel selfish for some of that, because it made me feel better after her passing. This time is so different than my other pets. I know that you all have the feelings of the guilt and I could have, should have, would have. I don't have that with Kaya, but this time I was so amplified in finding and researching and just doing everything I could this time, because I had a light bulb moment a little over a year ago. There's so many other ways to go about this. You don't just have to take them home to die and just watch them. There's so many other things, be it supplements or a PEMF mat, or, just different energy healings with someone like Melissa that can make them feel better. And in turn, that makes you feel better because you're doing everything you can.
Melissa, Elizabeth just asked in the chat, can you communicate with them after they're gone?
Yes, absolutely. And it's done the same way. It's through a picture. And generally I say to wait 30 days, but you don't have to. And the reason I say to wait is because when their physical presence is gone, the grief is so raw that sometimes you can't hear their message. You're missing it because you're still so in that rawness of the grief. But it's not necessary. But absolutely, I can communicate with them once they're gone.
Do you feel that really helps with guilt and unresolved feelings that so many people may be having? Because we've been talking a lot about anticipatory grief, but I know we've got a lot of people listening that have lost their pet suddenly or tragically or in an accident. And help us out there. What can we say that can comfort them? And the what ifs and the if I would have done this, maybe it wouldn't happen, and the guilt. What do you hear from their little babies?
Well, to echo what some of the previous speakers even said, they don't hold on to that. And the things that happen, they happen the way they were supposed to, even when it doesn't feel right. We can't blame ourselves. Guilt and shame are very heavy to carry. And the reality is we could have, you can say I could have done it differently, but we don't know what the outcome would have been. And we don't know that the outcome would have been different. So to hold on to that it's doing yourself a disservice, and it's doing a disservice to the animal that is passed, because they're not holding on to that. And I've seen many times when people connect with their pets that have passed, they do find comfort and relief in knowing that their animal is not mad at them, is not resentful. Those are not feelings that animals hold on to. Those are definitely human emotions.
Yeah. How do you feel that, I mean, we're all here, the three of us are certified holistic pet health coaches. And part of the reason we're here is because we've all had our own experiences, and we have been here and been inspired by the stories of our clients, our friends, our family that have lost their family members. What do you think is important in our role? How we can help with either a terminally ill patient or one that's lost their little fur baby?
Is that for me or Sandy?
Both of you.
Okay.
You go first, Melissa.
Okay. So I think so as a holistic pet health coach, you know, there's ways, like Sandy said, to support them naturally and to offer them comfort as they're declining. And it doesn't just have to be, you know, there are no options. There are options. Dr. Ruth has taught all of us that there are options. It doesn't end here. So that has been so inspiring in all my work, because there's always options. So just knowing that you can reach out to and connect with a community, any of us, and we can help you find and explore those options.
Thank you, Melissa. We're getting close to where we are going to have our live Q&A with both, we're going to have live Q&A with Leigh as our on-site and live counselor here soon. And then we will also have live Q&A for the entire panel. I know a lot of you have questions for Melissa and Anya regarding communication, and we're going to have information on that, on how you could reach out to them with anticipatory grief, how you can reach out to Sandy. Also I saw info on there if you are interested in becoming a grief counselor or a holistic pet health coach. There will be information in the chat as well. Melissa, what do you feel like is the most important thing for people to know about what you do, or if there's any misconceptions about how animal communication works? Now's your shot to clear that all up.
Okay. So I think one of the most common questions I get is when is it time? So I don't know that. I can only communicate what the animal is sharing with me as to where they are mentally and physically. But I don't have the crystal ball that can say, okay, on Tuesday at 4:30, that's the correct time. So letting that go, and that's kind of the whole control thing, but just letting that go and being present, I think, is probably the most important thing. Be present however you can. And I'm not saying don't be sad, don't have anticipatory grief, because you need to feel those things. They are real. They're big feelings. Find a community that can support you, and not everybody can. So forgive those people, but find the people that can. We are out there. There is a community of people that understands.
And what you do so much to, I feel like, relay that message. Do you think just that enough when you're relaying the message from the animals to the pet parents is the support, or how else do you support these pet parents?
I'll talk to them. I'll talk through the options, and I'll talk what it is, because there is a lot of weight around this. You know, they just want to know when it's time, because it's a lot of weight to make that decision. So talking through that, I will spend time talking to them about that and helping them process that. And I think that's an important piece of it, because it's hard, and I've been there, and I know it's needed to have that, to have somebody to bounce it off of, because even your spouse may not understand and just be kind of, you know, dismissive about it, but there are people that do understand. So just being able to process it and the weight of it, I think, is really important.
And for anybody listening that has recently lost a pet, or even in the past years, and didn't have the option for an animal communicator, or didn't know that was an option, Melissa, how can we go back and say, you know, it's kind of like going back to what Dr. Bruce said, that this is a journey, and it's their journey, and that's part of it. And I feel like in the end, we can't really do it wrong, because no matter what, our decision is out of compassion and love for them.
It is. And we're doing the best that we can with the knowledge that we have at the time. So going back, you can go back. Don't go back with a lens of regrets, though. You can't change it. And I will speak for myself. There's a lot of things that I could have done differently, but it's why go there? It wasn't meant to be differently. We had to go through something to learn, to bring us to this place, to know that there's options and there's other ways of doing things.
That's right. That's right.
Remember, your pet loves you so much just the way you are unconditionally. Don't tarnish that, because look at yourself through their eyes and just know that they love you and everything you have done and do with them. So you're not doing it wrong. They appreciate everything, and just keeping in mind that they don't process like we do and we don't have they don't have all of this guilt or would have, could have, should have. They just appreciate you for who you are in the moment. And if we can try to remind ourselves that, then it's a lot easier than putting all of our stuff on top of that.
Yeah, they do truly love us in all of our imperfections.
Yep.
And it's the unconditional love, which is the reason that it makes their loss so difficult.
Absolutely, because they're the ones that we are 100% ourselves in front of. With even the family that you live with in your home, they may not know all of you, and the animals know all of you. We communicate with them differently, even if you don't realize you're doing it. We're sending messages back and forth with them all day, and they love us. They love us for our imperfections and all.
Now, Melissa, you haven't been an animal communicator your whole life. You've had the inclination, but you've had your own tragedies and loss. And one of them that you had mentioned is little Jolie. And was it before or after, Jolie, that you became an animal communicator, that you decided to follow that urge and that inkling and that intuition that told you there's another way you can help?
It was after my loss of Jolie, and just becoming inspired by other people and seeing that they're communicating with animals. And when I started practicing it and taking classes for fun, I realized, oh my gosh, I think I've been doing this my whole life. As I believe probably you both and everybody on this call have been doing. And it's about just kind of practicing it and polishing that. Just like anything, I believe we all have it in us. But yeah, to turn it into a professional journey was inspired through loss.
How do you feel like just anybody can connect with them on a regular basis, and how do we honor their memory?
So a few of my favorite things would be to meditate and really just focus on grounding yourself and then opening your heart, and then call to them and they'll come. You'll get some message from them. It may take practice to quiet your mind. And I know if anybody's like me, you're going to doubt yourself. You're going to think that you're making it up. But at some point, the more you practice it, you're going to get things that are like, wait a second, I didn't make that up. And that's how you connect with them. Another way is honoring them through an altar, offering them something that they love. Because not only is that a recognition to them, it's you opening your heart with a memory of a favorite toy or a favorite treat, and you're putting that there. So all of that love is going onto the altar, and it just helps bring a space that is open to that, to receiving messages from them.
Sandy, is there anything else that you would like to add about your journey that you think would be hopeful or helpful and hopeful for our listeners today?
You know what? Whether you have a young puppy, kitten, or baby animal, just love it every day and do your best. And for their whole life, they will love and appreciate you back, and you have nothing to feel guilty or bad about. We all make decisions, whether it's emergent care or what to feed, whatever it is. We make the best decision on the information that we have at the time. So if you want to learn more, then educate yourself more, but just don't live in the world of regret. Just know that your animal loves you, always has, always will, and they think you're perfect.
That's right.
We all
That's
know we're
right.
not, but they do. So let's just think like they think.
And it's never too early to do a bucket list either. It's never too early to do a bucket list. You don't have to wait until things take a turn. You could do it when they're young and healthy and vibrant, and then you're present from an earlier time. I mean, there's no shame in doing that when they're a puppy even, right? I mean, it's because then you know, and that list may change over time if it is a puppy, but because they'll have more experiences as they age, but it's never too early to do one.
That's right. So anybody that's listening right now, I want you to start thinking about your questions. I know that there was a lot of questions ahead of time. If I can ask you to please submit your questions again, because we're getting close to the point where we're going to have the panel, and we're going to bring Leigh Gerk back on here in just a few minutes. So wanted to give you a heads up that if you've got questions, if you want to connect with Melissa, Sandy, Sunny, Leanne, any of them, your chance is coming up, and we appreciate your comments in the chat so much. And those of you that are sharing your stories, I have been trying to read them in between everything, and my heart goes out to you all, as all of ours do. And we're thinking of you. You're in the right place. And I hope that you found some of these strategies poignant so that you know that you're truly not alone. Anything else I can add, Melissa and Sandy, before we bring Leanne in for a few more questions and open up some direct counseling questions for her? You can stay on if you want. It's up to you.
It's up to you.
Okay. We want to be around for the fun. We can have the four of us until we bring on the panel, if we want to bring in more questions. So, Melissa, Sandy, anything else we need to add? Any
Thanks
questions?
everyone for coming. We're here for you. I think that this is a wonderful community, and we all understand deep loss, and everybody processes it differently. So feel free to reach out and ask questions, and we're happy to help.
All right.
And
Sounds
just
good.
go easy on yourself. I know it's not always easy to do that, but just give yourself some grace, space, and go through it. Feel your emotions. Don't reject them. Let yourself grieve. Let yourself feel. And whatever that looks like, it's right. There's no right way to grieve. There's no wrong way to grieve. However you need to, whether that's going into the woods and screaming your head off, do it. Whatever feels good, do it, because you need to move those emotions out of your body. And then you can be open. You can be open to reconnecting with them again.
That's right. So I'm going to ask this question to Leanne too when she comes on, but we had a comment. I've been wondering about anger. I was so angry with my mother years ago, the way she handled putting down our family dog, Bridget. Melissa, I'm going to let you answer first, and then Leanne, I know this is anger is your specialty.
Yeah, I actually have a personal experience with this because I had a childhood dog that was put to sleep as well. I did go to counseling for that even recently and did some EFT tapping. It's about forgiving them. And sometimes we're holding on to these memories from the perspective of a child too. So if we go back to that time and look at it with our adult mind and try to look at it differently, see your mother as that adult person and see how that decision was made. Forgive her, release it. We can't change it, but I completely understand because I had a lot of resentment towards my parents for putting down one of my dogs.
Leanne, will you hold your answer real quick? I have one more question that's pertinent to Melissa. She said that we had, let's see here. It's hard to keep up with these. Someone mentioned, Kathy says, I put my dog Dottie down a bit over a year ago. Are you able to communicate with her after this amount of time?
Absolutely. Yes.
I think it's
I've-
endless, the amount of
It's
time.
endless. I think the longest time, it maybe 35 years, I communicated with a dog that passed on 35 years ago. And it brought those memories back to life for this person. I mean, it's endless. It's energy, and it doesn't go away. So it's always there.
So one of the two biggest questions that I want to make sure that we all address as a panel, it seems that have been coming through, and they go hand in hand, is behavioral euthanasia and anger. So Leanne, I want you to talk a little bit about how we deal with this anger, either at somebody else, at how it passed, how it went down, or just anger in general. I mean, I feel like sometimes anger is just grief cloaked.
Right. Yes, well, and I really love what you said, Melissa. That's spot on. What I would say about anger, and anger is a secondary emotion. So there's something underneath that anger. And I agree with you, Melissa. You know, we have an emotion mind and we have a wise mind, and we kind of go back and forth between the two. So, your wise mind is looking realistically at what happened. Like you said, looking at your mom in a different way. But the emotion mind, it seems to be more powerful sometimes. And it's just, we don't understand why it happened the way we did. You know, we're angry that our pet is gone. And so I agree, we have to forgive. And that's really hard for people to do sometimes, especially when it comes to their pet. But you also have to think, what would your pet want you to do? They'd want you to forgive. And, I think it's important to be aware of what mind you're in and recognize the emotion mind. Maybe you need to write a letter. I'm just using your mom example. Maybe you need to write a letter to her and not send it. You've got to find a way to get this anger out. Maybe you need to do the empty chair. You have a chair beside you or in front of you, and you pretend this person is there that you're angry with, and you talk it out. Because anger, it just gets bigger. It has nowhere to go. So you've got to find a way to get it out.
That's right. We've had several people comment on behavioral euthanasia. Why don't we talk about that topic now before we get to some of the questions from the Facebook poll, so we make sure that we get them answered. And of course, anybody listening, now is your time for questions. If you would like Leanne or anybody here on the panel, I think after Leanne, after you talk about behavioral euthanasia, let's go ahead and bring the entire panel in. If anybody's got any questions for us now, you come first. You're here. We're present with you for healing. So we want to make sure that we address any questions you have. Okay. And I don't even know if you can talk about it, but you had a particularly tough topic. You've been through it with clients many times with behavioral euthanasia. It's tough.
Anytime you lose a pet, of course it's hard, but I have to say it's the people that I've talked to when they had to let their dog go because of behavioral issues. And I think it's so hard because all that pet parent sees is that wonderful, kind, loving, loyal pet. And it's so hard to have to say goodbye to them because you're not seeing the behavior like other people are. And it kind of, goes back again to wise mind versus emotion mind. If your dog, for example, is living in fear and it's it's aggressive, that's not, you have to stop and say, what is the quality of life that maybe my dog is having? Do you get to walk him freely, or does he have to have a muzzle on? Everywhere you go, it's going to be stressful, and it puts you on high alert as well. And so it's very difficult to question, what is their quality of life? And oftentimes they're this way because something's not right with their brain. And a lot of aggression is based out of fear. And, it would be hard to live in fear all the time. So even though there's nothing that's going to really make a lot of sense to you, I encourage you to look at the quality of life of your pet. And your quality of life matters too, because I've had so many clients, they've never had family to their homes, they've never had friends to their homes. They cannot go anywhere because they can't have anybody come in and watch their pet. So there's a lot of things that tie into it, and it is a very deep loss. And one thing, remember that if you do have to euthanize your pet, this is not a punishment to them. This is relieving your dog's suffering. And a lot of times, as soon as we relieve their suffering and pain, ours starts.
Yeah. Well, and you, as a professional counselor, you're hearing these stories every single day. And I can imagine that gets hard. And Beth, one of our colleagues who's also a certified holistic pet health coach and trainer, she just brought up about pet care professionals and shelter workers and volunteers that see this kind of stuff all the time. How can we support them? And I can't imagine how much Dr. Ruth has seen it.
Absolutely. And that's where, especially for helping people with animals, compassion fatigue is huge. You can only take on so much of this grief and the sadness. And that's why it's so critical, if you do work in this field, that you take super good care of yourself, meaning, you need to make time for a break. If you're, at the Humane Society, or like you said, anywhere, when these pets may not get a home, what do you do with all that? It just builds up. There are some humane societies I've read that even have a room where you can go in and scream. Like sometimes you just need to be physical and get it out, or you need to distract yourself for a minute. Maybe a veterinary hospital or somewhere, they might have coloring books in their break room. Something just to give you a little bit of that break, because this constant, as soon as somebody, especially in the animal field, feels like, you know what, I don't love this job. I don't think I was supposed to do with it. You need to stop and think, why did you come in to this job in the first place? It's because it was your passion. And as soon as you think, I don't like this anymore, that's a big red flag that you're experiencing some compassion fatigue, because everything changes when you're burnt out.
Right. Yeah. That's all changing. I'm reading through some of the comments right now, and I am just overwhelmed with my heart is just really big for all of you right now and goes out to you. I've been reading some of your stories, and it's hard to kind of read the entire story, but if you have a specific question that has to go along with your story, if you can go ahead and type that now. I am trying to stay on top of it all at the moment. So I'm reading them. Once again, I'm glad you're here. We're here for you. And we hope that we can get your questions answered and help you process and open up this conversation. Real quick, we're going to go. Can we, Delora, can we bring Anya in? We have a question for Anya and Melissa. We have someone who posted, Lisa posted,
You
I
said,
have
I was just looking at that one.
Okay, so I'm going to read it for everybody. I have been told by numerous communicators that my dear loves that have passed have difficulty communicating with me because my constant grief makes my energy low, which is making it difficult for them to get through to me.
Do you want to go first, Anya, or do you want me to speak on it
Um,
first?
Whatever you like. I
Anya,
have
go
something
for
to
it.
say.
Anya, I'm
Yeah.
gonna say you go first.
My initial response to that is that the animals are not having difficulty communicating with us when we're distressed. We might be having difficulty hearing them. So that's the way I would look at it. And that's something that obviously someone like Melissa or myself could help with, because we are going to be the intermediary for you there. But essentially, your animals are in constant connection with you. They know exactly what's going on. They're observing you and also getting on with their own journey, because both can happen simultaneously. And it's a matter of not investing in that thought too much, that your grief is too strong for them to communicate, because that to me is simply not true. And just allowing it, again, as we've been saying all through this workshop, allowing it to happen, your feelings to happen, to be expressed, and you will move through them to a more receptive place or a more serene place. It will happen.
Thank you, Anya. Melissa, I actually have another question for you. We had somebody say, my pup Rascal lived for 1 year and 1 month past her brain cancer diagnosis without any chemo. Did I do everything I could do?
Yes. I mean, I truly feel that everything unfolded the way it was supposed to happen. And I think that's commendable that your pup lived 1 year and 1 month past what was given as her date. I don't like the dates, to be honest, but think of what you gave her, an extra year and a month. That's beautiful. And go easy on yourself. That's no regrets about it. And your pup does not have any regrets either.
I feel like this is a common thing. Have we done everything that we can do? I've even said it to myself. Am I doing everything I can do right now? And it has its own sphere of anxiety and this anticipation around it. Geez, maybe I've been talking too long on here. So Leanne, is this a question that you get a lot? That you have, I know we've kind of touched on it before, but let's do a deeper dive into those that are struggling. Did I do everything I could do? Could I have done more? Maybe I could have done more. And it's just ruminating and marinating in their minds and their hearts.
Yeah, and that is so common. And I think part of it too is when we lose them, we're just, our life, especially if you're doing euthanasia, our life feels so different that we're like, oh my God, why did I do this? I chose to do this. So we can start ruminating on that. But I lost my train of thought too, Melissa.
Okay.
So
Maybe
repeat,
that's our sign that we've covered it all.
repeat your question again. I'm sorry.
We've had a lot of people talking about, could we have done, we just had a question, could I have done more? And I know that I've gotten it. I know that a lot of my colleagues are doing it. Am I doing everything I can? Could I have done more? Should I have done the chemo? Should I have done the surgery? That's something with Sunny too. Should I have done the surgery?
Right. Well, and when those thoughts come, you have to remember you did the very best you could at the time. If you're in a crisis situation with your pet, you have to recognize that you were in a crisis situation. It's really hard to think things through, but you did your very best. That's all we can expect of ourselves. And it is hard when we look back, but that's why, you've got to stop and say, is that true? Did I really do that? Or do I perceive I did that? Because a lot of times it's our perception. And again, like I spoke earlier, we feel responsible, even in death, even though we don't really have that responsibility. It's not part of what we do, but we feel like we should.
I feel like it's such the human nature to second guess everything we do.
Everything. Absolutely. And I think you even second guess yourself more when you're grieving, because if you're second guessing yourself, you're not feeling so helpless, because grief makes us feel helpless.
It grips us in a way that we could never imagine.
Right.
And it changes it changes the chemistry of our brains. I shouldn't be saying this. You're the counselor.
No, but great. Go ahead.
Well, no, it's changing the chemistry of our brains. It makes us think and act and do things differently. And sometimes it's just beyond our control.
Absolutely. And you
Definitely
have to
something we can
recognize that it is beyond your control. And I've even had clients write a letter to themselves. Talk about what a great pet parent you've been and you did your very best. And your pet would want you to treat yourself as kindly as you've treated them. And that's really hard for people.
Yeah.
But sometimes you have to stop and say, okay, what would my pet want? And if you can't do it, sometimes just for yourself, do it for them.
That's right. I have another question for you, Leanne. The question's from Jane. She said, I have a friend who recently was diagnosed with Alzheimer's and is in a facility. She had to give up her 2 dogs. How would you counsel this friend who is under the impression her dogs are not being well cared for, especially with her current mental situations and limitations?
I'm very sorry for that situation. That must be really difficult. Um, the best way, I don't know if you could take pictures that show that they are being taken care of. Because, as you know, when you lose your memory, it's kind of the same constant thoughts, even though they've been answered. I don't know if there's any way maybe the dogs could visit. Could you talk to the person that's with the dogs? Let her say what we've done today, share pictures, because that's a horrible situation. Does she have people that she trusts with the answer? Because I think when it comes to our pets, we always want to make sure, are you telling the truth? Are you just saying what I want to hear? So I think she might need something visually to see.
Right. Does anybody want to add anything to that?
Just to say, I think that's a great idea. Visual. Having my mum had Alzheimer's, so I do know a bit about what they might need. People who are suffering from that. I think that's visual. The visual thing is a really good idea. Very sad situation.
Leanne and Melissa, this might be something both for you. Let's see here. It looks like Sathia. I hope I said that right. I may not be able to read your entire story, but the summary of her story is that she had an animal that passed, and it took her 40 years to get another animal. And now that pet is having some health issues, and she's already dealing with the PTSD of the prior pet's passing, and it's hitting her really, really hard. And I could just feel from her message that her heart is breaking. And her last question was, how do I survive this?
Well, I'm so sorry you're feeling that way. I understand why when people lose a pet, it is so complicated sometimes and so tragic to us. It does cause PTSD. And I've heard so many people say, you know what? I can never do this again, ever. I can't go through it. But I try to, remind them that, when you feel that way, look at all the years you did have. Would you want to erase all those years you had to protect you from this feeling? And they always say no. And I also remind them, sometimes we forget how strong we are. Loss is not only just death. There may have been a loss of a job, a marriage, whatever it may be. And I'm sure there's been a time in all of our lives where we thought, there's no way I can do this. I can't get through this. I just can't. But you did. So sometimes when we're having those feelings, it's really important that we go back and think about the times where we didn't think we could get through it, and we did. We sometimes have to remind ourselves of that strength. But I also understand, you're just waiting for it to happen. And again, that's kind of the emotion mind and the wise mind. The wise mind is saying, this is a part of life. But you might remember, as hard as it was, I know you waited 40 years. I'm hoping you don't wait that long again. But it's a part of life that we can't change. And I'm so sorry you're going through with it, and going through this grief.
Yeah. Do you hear a lot of people say, I'll never be able to get another pet? My
All
heart
the
is
time.
too,
All the
my
time.
heart is too broken.
Pardon me?
When they say my heart is too broken to ever get another pet.
It's so sad because I remind them, it's people just like you that have that heart that understands a human animal bond. I know your heart is broken. And one client said, and this was a great way she looked at it, for every loss she had, there was a hole in her heart. And she said, instead of thinking that these holes are shrinking my heart, I looked at it as it's making it bigger. And I can't replace my pet, but I can add other loves in my heart. And so that helped her get through it. We need people that are afraid. You're the very people that these animals need.
Anya, how can you talk a lot about opening your heart too. How can we protect our hearts when we know that we have so much love to give, but as I've mentioned before, the tough and crazy and wild thing about this relationship that we have with our pets is that we know that we're going to outlive them. And the
At least,
reason we're here is, what do we do when they're gone?
yeah, at
So
least
what's
probably
your
of
advice
them. It
to,
depends what age you have your animals. Because that's another, let me just interject here with that, because that is another issue for people. I'm beginning to get into that age group where we think twice about getting another animal because we might well die before them, and then what will happen to them? So that's another whole area. But it is relevant actually to me, as you know. So, and now I can't quite remember what your question was. Sorry, Melissa. It was to do with
No, that's
how.
okay. And maybe I was asking is how can we cope with that PTSD from a prior animal when we have an animal now that's going through it? I know that's something that Sandy went through, and it was a different experience for her next time, and maybe she can come on and add a few things to that too. Sandy had 2 animals pass, and the same with Sunny. This was a big deal for her. She had 2 animals pass, and the grief was so overwhelming for her when you've got the PTSD from the first animal passing. This relationship is all about love. And how can we keep opening our hearts to that love when our hearts are also shattered?
Because that is what the heart is, and that is who we are. We are intimately and ultimately, we are love. Love is the life force. It is who we are. So I think that if we can perhaps turn it around slightly and think, who can I help? Who can I give a loving home to? Who needs a home? And we know there are so many, many, many animals desperate for a good home. So if we can turn it around in that way, I believe it's often the most amazing legacy we can create for our animals who have passed, is to offer our love to another animal. And very often our animals who have passed will push us into situations where this happens. I've seen that several times. So it is a matter of courage. It is a matter of having the courage to open our hearts again, to love again, to dare to do this again. We don't have to, but to close our hearts to it when we truly, deeply want to is a self-punishing thing.
You're absolutely right, Anya. And I wanted to add, that's like saying once your pet dies, the love that you shared with them was so special. It's like saying, you know what, I'm not going to let my heart love again. Like, it doesn't sound very promising for the future, because like you said, that's what our hearts do. And, having another pet in time, people always say, well, when should I do this? There's some people miss a pet so much they want one right away. Other people will say, I just can't. So just remember, you need to always feed your heart.
Absolutely.
So, Leanne, we have had 2 questions regarding how to help someone and when to get help. And so a colleague, Rena, posted that she feels someone in her life is getting to the point where it's dangerous because the grief is so overwhelming. Let's tackle that one first.
Okay. Well, and I'm glad that you were noticing these changes because it is important. You know, sometimes people get mixed up between grief and depression. And so I'll just briefly explain them. You know, grief is, of course, you're very sad, you cry. Sometimes you don't want to get up, but you do. There are moments of joy. You might laugh at once in a while, you might smile once in a while. There are moments. But that, if it goes too far, can turn into depression with your pet loss and grief. Depression is more like you won't even get out of bed. You won't even leave your room. You know, it's a super dark world where you're just in it, you know, you're isolated. So with your friend, I'm so glad that she has you to keep an eye on her. I would, if you could get her to see someone, I think that would be wonderful. It could, you know, if she doesn't want counseling, I think that would be very helpful. But see her medical doctor, you know, because you want to work with her if it is depression before it gets too far gone. She might not want help. And so maybe what you do is you go over and sit quietly with her. You know, sometimes we always it's our human nature to help people and we want to fix them, but sometimes we just have to be silent and just hug them or just sit with them in their silence so they don't feel so alone. Does that answer that?
Yeah, and just a reminder that Leanne's contact information is in the chat and will be available in the follow-up email. And Rena, Leanne may be able to help you a little more with some language that's more specific to your friend and what to say with her outside of this so we can get to more questions. We have another one. I lost my beloved Cavalier to a sudden heart attack when at the cardiologist, and I didn't know. How can I get to a point where I can open my heart again? I feel like this is this is something we've touched on. Is there any other tidbits of advice that we can give her?
Again, afraid to open her heart.
Afraid to open her heart to another dog.
You know, I always say, well, the dog that passed, what would that dog want you to do? Would they want you to help another friend in need? You know, what does your heart need? Can you really survive without the love of an animal? You know, as we talk, we need our human family too, but that's very different. For a lot of people, their animal is their only family. So it's life-changing if you choose not to. So, you know, a lot of people are afraid that they shouldn't get a pet because their other pet will get angry. That's not what it's about. They want what you want and they need what you need. Sometimes it's recognizing what do I need.
And we did get that question in the chat. Melissa Sherman, we have another question about a 14-year-old dog that has degenerative myelopathy. So he's losing sensation in his legs and he's in a wheelchair right now and they're doing acupuncture. He still eats and drinks and all those things. She says she's struggling with anticipatory grief. So Sandy, if you want to pop in too, great. She says she doesn't know how to know when her dog is ready. And she says, what if he never lets me know it's time?
What I'd like to say to that is that he will let you know. But you can find someone that can help you with that too. But really just connecting with your dog. You know your dog better than anyone in this room, your veterinarian, you know your dog better than anyone. You're going to know. It's a feeling that comes over you, and that's them communicating that with you, that it's time.
Okay. There's two more topics, just so I don't forget, that we're going to cover that has been predominant in the chats. And Anya, you brought up the topic, and it had to do with should we get pets as they're older? I'm worried about what's going to happen to them. And I know, Leanne, you have talked about that it's different when the elderly lose a pet.
It is different. Briefly, Anya, I'll just say this. Oftentimes the elderly, they're going through two huge losses. Not only have they lost their pet, but based on age, like you had mentioned, Anya, they're afraid to get another pet. So, they're not only they don't only have the loss of their pet, they have the loss of never being a pet parent again. That's devastating. So I always try to remember, people are now tell my clients, people are now putting their pets in their wills. There's resources for the elderly. If they want to have a pet but can't walk them, there are people that can come and walk them. So I encourage them, not to look at it as they never will again. If there is a way, I could help them find it.
So Anya and Melissa, we've got two questions. And we're getting a lot of questions about this. So let's address, no matter what you believe, we'll talk about it a little bit. We've had questions, do our pets reincarnate and do they come back in another pet?
I do believe they do. I've seen it. I've had clients that have experienced it too, where they have an inkling, and they're coming back, they're joining your love again, and it doesn't always happen. So don't think that if it doesn't happen that there's something wrong or you did something wrong. Sometimes that lesson is just complete and we're on to the next. But there's a lot of times they do come back, and there is still more to be done with them.
Anya, do you think that we share past lives with our animals? Another question we got.
Yes, yes, for sure. I do believe so and have experienced so. By the way, my cat Sam, who passed over in July, who was 19, he was the third time round with me this life. And I know, I'm convinced there are certain things about him that made this very clear to me. That's just as an aside. Yes, again, it all depends what you choose to believe. My own sense is that our animals are part of our soul group. Now, our soul group is a group of souls who travel with us through many lifetimes and are our allies. They can sometimes include people or animals who cause us difficulty, but essentially on a soul and spiritual level, they are here to accompany us. We accompany each other through many experiences, and that is true of our animals. So it would seem to me, if you believe that, it is logical that we will have different lives with our animals. And some may be where we have been animals or people, or, we've been their animals and they've been people. The possibilities are endless because the universe is limitless.
That's right. That's right. The universe is limitless. Thank you, Ani. That was a great answer. And Karen, I just want to recognize you. You're not alone. And I know there's a lot of other people that feel like that. You're brave to share your story with us. Thank you. Karen was saying that she was so depressed after her dog Lulu passed. She walked out on her job and stayed home for 6 months. And realized she had 3 other dogs to care for, and she only had one friend that would come by and say hi. And I hope today that one of the number one things is that we break the stigma around pet loss. It is just as hard, if not harder, than losing a human in our lives. And we are here to support you because we recognize that the support is so, so, so needed.
Absolutely.
And by the way, Karen she is now a certified holistic pet health coach, and has gone from a story of trauma to a story of victory. And we're proud to have her here. So just a few notes here. I'm going to look at some of the Facebook questions. Anybody who is here now, continue to post your comments in this chat. We are going to take about 10 to 15 more minutes before we do wrap our pet loss symposium for today. I do have a little surprise. We had somebody that was working on another video. For those of you who had submitted pictures late, we were working on another video for you in the background so that we can honor your pets. And we are going to close with that. After I close and say goodbye to you all today, Delora will put that video up so that we can continue to honor your pets too. And then after it's done, we'll say goodbye and continue to support you in another way. Let me just check our questions here real quick and see what we've gone through. So one of the questions was, are there resources for grief support for anticipatory grief or after the pet has transitioned? Yes, there will be resources for that. Melissa, Sherman, and Sunny have started a Facebook page. There will be resources in there for the free pet loss support groups. Leanne, maybe you can talk about that for just a second, that there is a link, Delora can put it up. And will you tell us what it is again?
Sure, it's Delora will put it up, but what it is it is a really awesome link because it applies to anybody in the state. So once you get on, I think it's called pet.net. But anyway,
Petloss.net, yeah.
yeah, right. You go up, it lists all the states, and you just up in the left-hand corner, you click your state, and then it'll give you lots of resources for your state. It might be individual counseling, it might be, if you want an in-person support group. But I want you to know one thing that's different with support groups. They're very important, but you can cross all the state lines. So on there, it gives you a list of support groups, and anybody can join them. They're free. You can go state to state, and those are really helpful too. Sometimes you don't know when you're going to have this, the deepest loss that you feel you might be alone. And it's nice to know that maybe you can connect online with someone at that moment.
That's right. Let's touch on this again. We got another question of, how do you deal with the multiple losses in a short period of time?
And who?
Go ahead, Leanne. Did you hear me? How do you deal with multiple losses in a short period of time? What are some coping strategies?
That is super hard. Because I think what happens is you've had one loss, and say you have a pet that's sick, you don't even have time to mourn your first loss because you're worried about your second pet. And then if that pet dies, and so on. So I think it's important to recognize that each pet deserves some of its own time for your mourning. And that's really hard when there's lots of them. So maybe you could just say, I'm going to go on a walk and I'm going to think specifically for this pet this time. And the next time you might include the other one, or you might look at them as a whole because they were all part of your family. But my heart goes out to you because multiple losses, it just feels like you're knocked to the ground and maybe you're just getting up and then there's another one. And, any unsolved grief that you have, you don't even know it. If your pet dies, you may not even recognize that, oh my gosh, I didn't grieve for this other pet or for a human family member. It can get really big. So I always suggest, if you have a counselor that you can process this through, never be ashamed or embarrassed or scared to reach out because this is really hard stuff.
We're going to jump back to anticipatory grief for a little bit. Thank you for that answer, Leanne. That was really good. We did have a question from the Facebook group regarding anticipatory grief and not going to the vet because they don't want to know what's wrong. So how can we address this? This person indicated they know it's about their dogs, but they're terrified to find out what might be wrong. And they don't want to go to the vet because of that anticipation.
Is that for all of us? Or
Anya, do you want to go first?
I mean, that's a difficult one. I think
It's
in
difficult.
those sort of situations, we would need to just try to get clear what our role is. You know, the responsibility we have to make things as easy as possible for our animals, and also ultimately easier for us, because that state of sort of paralysis through fear is so uncomfortable, is so exhausting. So I would say it would almost be an act of love for you to just take that step to get the information you need. And when you've got the information you need, you can then decide what you're going to do with that information. But just sort of thinking you're protecting yourself by just not wanting to look actually is not going to protect yourself in the end, is my feeling. You will feel perhaps worse, you know, if you had not gone and just seen what was going on. That would be my take on it. So it's a matter of just
Absolutely.
grounding, getting centered again, and coming to grips with who you are in the life of your animals.
And I think also, I understand that fear. It is scary. You don't want to know. We just kind of want to pretend everything's okay. And again, that's your emotion mind. So maybe your wise mind is saying, you know what? I've got to do this. It's, you know, for the welfare of my pet. But also, let's say that you don't and something happens to your pet. My concern is going to be that ugly guilt again. Ugh, why didn't I take my pet? So, you know, we always do whatever we can for our pets. So I encourage you to be strong and brave.
Yeah, that's very good advice. Leanne, I have a question for you. Maybe we can just put a resource in there later that you can add, but it was regarding caregivers and counselors and vets. Where can they find support for compassion fatigue?
You know, that's a really good question. I've had a few different places email me and say, where can we get this help? And I don't really have a great answer, and I'm so sorry, because it's those very people that absolutely need help with their compassion fatigue. There are, I know there's some people out there that deal specifically with compassion fatigue, and maybe you could have them come to you. But that is something I've thought about, that maybe in time, maybe that's something I might focus on as well, because compassion fatigue is hard. If you could at least, maybe if you're, working somewhere, maybe your boss can go and learn about it and bring it to your facility. There are ways. You do need a break, and there's, go to the break room or whatever it may be. But compassion fatigue it's really difficult, and you need to see that you can get through it. What are some things that you can do to get through it? And I think a lot of you probably recognize you do have it because you're not loving your job anymore. So I wish I had, you can go exactly right here. I have not found that yet. So that's maybe something that I can focus more on and try to find those resources.
Can I add
We're getting
something
close to
to
coming.
Melissa?
Oh,
I just wanted to talk about a resource really quick. Sunny and I are studying with Kathleen Prasad, who's of the Let Animals Lead method of Reiki. And she has a nonprofit, and it's called Sarah, and it's Shelter Animal Reiki Association. They have practitioners that go to shelters and actually they give Reiki to the people, not just the animals. So I dropped the link in the chat, but that's a good resource. If they don't have someone in your area, they might be able to provide more resources. Also Bright Haven, I'll look that up and drop that in there too.
We're going to take one more question, and then Leanne, Anya, and Melissa, before we wrap this up and give my closing, and then we'll go into the video. I want you all to give your top couple of coping strategies, any parting words that you want everybody to take with them. Leanne and Anya, I think you can both talk about this. Maybe all of you can. We have a question. My boy was the sweetest, kindest soul. He passed in my arms in February. He'd been in so much pain. I feel he's been communicating with me more than usual since my birthday last month, and he knows how broken I am. I also think he's been communicating me by leaving messages with our older dog. One day she ran to a spot and started sniffing the area where her tail, and from that day, I swear she was different and hasn't left my side. She said, I think my dog that passed told her to look after me.
Aw. Anya, I'm going to let you take that one.
Yeah, Anya,
Yeah, well, that certainly sounds like it. How beautiful, how beautiful. Yes, we didn't get a chance to talk about that, but the signs that our animals leave us are absolutely amazing sometimes. And again, you know, opening your mind, your heart to that possibility and almost setting the intention to ask them for a sign, and it will be something that means something specific to you that you love or that they loved or that you loved together. Setting that intention, and then when you notice things, which you will, don't brush them aside, believe them. Because once you've put out a request to the universe and then all sorts of stuff's coming back at you, but you're saying you're not seeing, you're not, no, I'm imagining it, then they might just stop sending them. So that would be my comment about that. But that's beautiful. Yes, I mean the animals will be discussing things between them, and
I think that's great. I'm just going to add something to that. You know, I've had a lot of clients say, gosh, I haven't seen my pet in my dream. My friends have, or so-and-so has. Why haven't I? Does my pet not want to see me? And I found this, it was just a real short article, and it said, you know, if your pet doesn't come visit you in your dreams, remember that your pet wants to visit you when you're awake. And every time you think of your pet, they're with you. Every time you hold something of theirs, they're with you. And that's really comforting. And they, you know, so every time you think of your pet, they're there. And people find that really comforting because sometimes you won't have a dream about them, but just know that they are with you in a different way.
Yeah. We're going to take this last question before we go into the video and the last comments. So Elaine says, my Yorkie died a painful death. She was saying that he was adopted as a senior and she thinks he lived to be 23. She said that her heartache, though, is that he was crying in pain up until his last breath. She thought his death was going to be peaceful, but he was crying in pain until his last breath in her arms. She said it's been almost 2 years this Christmas, and she just can't shake the guilt or get those final moments out of her head. She feels like she failed him, and she can't shake the guilt and the grief. Leanne.
I'm sorry you feel that way. I think it's important for, you know, he lived to be 23. He had a great home. That shows that you did a lot. I think it's really important that you specifically think of your pet's whole story and everything you had that led up to it. You know, we all want that peaceful goodbye. And sometimes we don't get it. You know, life is really unfair. And I'm so sorry that happened to you. Some things are out of our control, and it sounds like that was something out of your control. And, you know, if you want to maybe write a letter to your pet, if you do feel guilty, you know, do you need to write a letter that says, I'm sorry to your pet? Would that help you? You know, I'm just so sorry. That's a really hard thing to live with. But I think you need to remember all his wonderful life up until then. And, you know, there's really no words that are going to, if I had a magic sentence that could just get rid of your guilt, I would sure say it. But that's something that has to come from within, and you have to recognize it, and you have to forgive yourself. And you know, I can't say more because I can't I can't persuade people to not feel guilty.
Well, Leanne, you've always said that the ending is part of their story, but it's not their whole story.
Absolutely.
And
It's
So,
not.
Anya, what can you add? And Dr. Ruth, too.
Yes,
actually, yes.
Oh,
Sorry,
sorry,
Anya, please.
sorry, Ruth. I
Please,
just wanted
please,
to
please.
say, but you will know more than me about this, that, you know, having gone through my cat's natural death only a few months ago, which was the first time I'd experienced it, I do think it was slightly disturbing. It wasn't just a sort of peaceful falling asleep. However, I do believe, and maybe Ruth, you will confirm or not this, that when animals or when we die naturally, we go through all sorts of physiological processes, and that can look like being in pain, perhaps sometimes, when actually it's not. It is natural after all. Death is natural. And I think that sometimes Sam was making strange noises, but ultimately it was peaceful. So I just wanted to put that in, that perhaps it wasn't quite like you've been interpreting it, and perhaps that might ease your feeling of guilt as well.
And that's exactly right. There's a lot of things happening physiologically as the body starts to switch off. And some of that can look very, very scary. We're not accustomed to dealing with natural death in this country. We're accustomed to, with people in a hospice situation, for many of them to be very, very heavily sedated. But there is, what did she call it? Terminal agitation. This is something the palliative care doc was telling me about my mom. Unfortunately, the last day was pretty rough for both of us. But the beautiful thing is that it was not so much that she was painful or distressed as it was her soul was sort of two different places, sort of half in the body, half out. And that's confusing. When animals or people re-enter the body fully, it feels very weird because the body is losing its energy and vitality. So it can be really, really confusing for us. There can be, even during euthanasias, there can be vocalizations, there can be movements, there can be all sorts of things that we try to circumvent that we just can't, because it's physiology and things happen. They can look horrible, but in most situations, I don't believe that the pet is feeling distress. It's just that their body is responding in the way it must to some of these neurotransmitters.
Mhm. And if I could just add to that, they're not carrying those last moments with them on into the next. That's we're holding on to that trauma because it was traumatic to see. But once they've released that energetic release from their physical body, they're on to something else. They're not stuck in that moment where it's us, then maybe we need to ask for help and support to work through that and process that pain on this side, the emotional pain of witnessing. Because as Dr. Ruth said, unnatural death, we don't really talk about it. We're not really prepared for what that looks like in humans or in animals. So it is uncomfortable, and it's something we have no control over. And when we're used to being able to control situations, we have to surrender to that moment and let it go, let them go, and hold on to everything that led up to that moment.
I just want to share a story that I saw in the comments. Thank you for your answers, Dr. Ruth and Melissa. My sweetheart dog passed away an hour after I walked in from the hospital with my baby. It was the most incredible and painful story and struggle with the timing of it all. Everyone says it was meant to happen, and he held on to meet my baby. I pray I can communicate with my dog someday to understand more about this. Anya and Melissa, whoa, whoo, that
Yeah.
one.
That's unlikely he did hold on to meet your baby. I mean, that was something that was important to you, and he held on for that. Like I said earlier, they do hold on until we're ready. And it may have taken to that moment that he saw you were okay, that he could release.
I agree.
Dr. Ruth, I have a last question for you, because as I'm watching the comments, and I know you have been too, I feel like a lot of people, I just want to touch on it again. Even if their dog wasn't terminally ill, if they were in an accident or something, there was a choking accident or something like that, a lot of people seem to be struggling with, did my dog suffer? How, from a veterinary perspective, how can we help with that? And maybe it's more of a spiritual answer as well.
I think that's it. I mean, it really is more spiritual. There are situations where, a horrible trauma happens. Your dog's been hit by a car, something like this. There was some suffering. There just was. But n- not all suffering is bad, and it makes us understand how precious life is. A dear friend of mine many years ago had a horrible bicycle accident and broke her pelvis at 40. And it's, as we've all gotten older, it's been rough for her. So when I'm out biking, sometimes I'm thinking to myself, oh my God, I could, fall off my bike and tumble down the mountain and break my pelvis too. So we can stay in that fear of that thing happening, or we can say, gosh, that was a horrible accident, and I'm so sorry that that happened, but it's not something that happens every day. I think that that's one of the things we struggle with, because we don't, I mean, honestly, we don't deal with physical trauma and accidents and things of that nature the way that we all did 40, 50, 60 years ago. The likelihood of us being exposed to a physically traumatic experience is so much smaller. And when I started in veterinary practice, I wasn't treating cancer, but I would every Monday, every day, I was treating dogs and cats that had been hit by cars, gotten into dog fights, been attacked by other animals. And so that's it. We have this horrible situation now where we're dealing with cancers and chronic disease and all of that. And that's a whole nother segue. But we don't deal with that physical accident type trauma on a regular basis anymore. So it's so shocking now when it happens.
It really is. It really is. I grew up on a farm, and unfortunately I got lessons in life and death really early. And there was nothing that could protect me from that. But I think you're so right, Dr. Ruth, that by and large, we don't see these kind of tragedies now. And when they do happen, we end up being ill-equipped to handle them, and our level of acceptance has gone down. And on that note, just a reminder, I'm so happy that you all have joined us, because your grief is accepted here. And that's a part of the process. It's like the book Radical Acceptance. It's happened, we're still connected, and your grief is valid. Before we close here today, Leanne, give us your top coping strategies as we leave today.
One of them is, it may not sound like a strategy, but it's how you look at things. So often people say, I loved my pet so much. You know what? Death cannot take away your love. So instead of saying past tense, loved, always say, I love my pet and my pet loves me. That is still truth, and that is still there. So always remember that. Some strategies. A lot of people find comfort in leaving their pets' things where they are. Maybe their food bowls, a bed, food. I've had people say, "Oh my gosh, I still have their bowls out, and it's been 6 months." That's okay. There aren't any rules on when you need to put your pet's things away. So for a lot of people, that brings comfort. If it doesn't bring comfort, you can put it back. If you were used to your pet sleeping with you and you just miss holding on to something, oftentimes if you get a stuffed animal, similar in size and color, it gives you that tactile feeling that you need of holding on to something. As we talked, remember their whole story. write letters. You can write an obituary. You could do a memorial. Maybe you want to plant something in your yard. If you don't have a yard, maybe you want to just buy a new plant for inside your home. If it's in a small vase, you could put their collar around it. You know, it's important to still take good care of yourself. I had an older gentleman. He said, I don't walk anymore because I only walked my dog. So we came up with something where, he knew he needed to exercise. So he kept his dog's collar in his pocket and he would thumb the tag, and it turned more into a reflection walk and a memory walk. So it got him walking again, and he felt comforted having his pet's collar with him. You know,
I liked your idea of buying the star.
yes. Yes. So you could buy a star. I have that in the back of my book, Dear Brave Friend. Put a star, buy a star. And when you look up, you'll remember them. That's really special. I'm looking here. There's so many different things that you can do. And you know what? Find the people that understand. Go to support groups. You know what? People are like, I don't want to go, I'm going to cry. Of course you're going to cry. The more you love, the more you grieve. So don't be ashamed of tears. Your heart is broken. But talking about it, sharing your pet story is so important. And say your pet's name out loud all the time. Say it. That's really important.
That's right.
And
Do you want me to we can close with you, Leanne. Dr. Ruth, did you want to add any final thoughts before we close?
Melissa, I just want to say thank you for coming up with this idea. Melissa, Sandy, Sunny, Leanne, Anya, thank you for participating, because I think this is such an important topic that doesn't get discussed. And what I'm seeing is that a lot of people have gotten so much value out of this and are feeling better and feeling like they have another path forward in life. So thank you for being brave, for those of you watching and sharing your stories, as difficult as it has been, because sometimes just getting those stories out and verbalizing them and finding that, nope, you're not alone, can be incredibly healing as well.
Anya, what would you like to add? Oh, there we go.
Oh, yes, I mean, I think it is very brave of all of you, and I think it's extremely healing. At least I hope so, that you've been able to share in this, and I hope you have found it useful for your, as Ruth said, for your way forward, and that there is hope and life does go on, and this is not the be all and end of it either. That would be my last words.
Sandy and Sunny, I'm glad that you popped on. We're getting amazing comments, and thank you. Again, Kimberly, when you said this is a very important group and an unmet need, thank you, dear. I'm glad that we could touch you and touch your heart and those of so many of you. Sandy and Sunny, is there anything that you'd like to add before we go in our closing and final video? Thanks for popping in.
I just want to remind people that pets live in the moment, and if you can do anything every day, just think like them. Be happy with them in the moment. I have boxers, and those wiggle butts just melt my heart. And it's a big reminder for me to just be happy like them and don't fret about all this other stuff. Just take care of them, love them, and enjoy them.
I think we need a new slogan: have the presence of a pet. Live in love and live in the moment.
I love it.
Sunny?
Yeah, I just want to thank everyone for being here today. It's been incredibly comforting. And also, although it was hard to share, I just think it's important to remember that when you do feel alone in your grief, that there are people out there that understand you, and just surround yourself with those, and everything's going to be okay. And keep loving those pets because they need us.
Absolutely.
Miss Melissa.
Just to echo what everybody else is saying, really just find your people. Find your people that get it. We get it. There's a lot of people that get it. And thank you all for joining and being vulnerable. And I think this was healing for me as well. And this community is really needed. And I appreciate every single one of you. But love your pet in the present, in the past, and no regrets. Just release and love again. Just open your heart and love again.
I want to echo that as we come to the end of our workshop, and my heartfelt gratitude to everyone involved, and Sunny, Sandy, Melissa, everyone for having the courage to tell your stories. And those of you in the chat that were present, having the courage to be here and share your stories. It takes strength to do that, but all of this is the part of the process of opening your hearts. And this is not where it ends. There's going to be continued support. Continue to be involved with Dr. Ruth's Facebook page and following the links that were provided by Delora in the chat, because there is invaluable resources and recommendations there for you. And to our presenters, Dr. Ruth, Anya, Leanne, Melissa, Sunny, Sandy, your expertise, compassion, and wisdom, and your insights have just been wonderful. And I know everybody appreciated it, especially me. And not to mention, like I said, the courage it takes to share your stories. Thank you again for showing up. To everyone. Your strength and your resilience, it's really, truly inspiring. And as we close this out, Delora is going to play the video of the pets that we didn't get in. It's just a short video, but we would like to add that on. So if you'd like to stay on that and see that, please do. Remember that there will be continued support through email. Also remember that healing is a journey. It's not a destination. And the tools and insights you've gained today are here to support you as you move forward. You are not alone in this process. And once again, you'll receive more information from those presenters, and we'll include links to Circle where you can continue the conversation. I hope that as you go and you leave today, I hope you may find comfort in your memories and peace in your hearts as you honor the love you shared with your animal companions. Until next time.